Thanksgiving. I want to welcome our Advisory Council to Support Grandparents Raising Grandchildren members to the second meeting of the Advisory Council. I also want to welcome the folks from around the country who may be tuning in to watch this meeting. As I said, this is the second meeting of the Grandparent Advisory Council, and we have a very packed agenda today, and one that I hope will move us forward. And Lori Stahlbaum is going to be discussing, providing an overview of the agenda in just a moment. But before we get started, I wanted to do a quick roll call to see who we have on the call, and also this would give us a great opportunity to check audio. So for the council members, if you could please unmute your computers or your phones, and when I call your name, just say present. Council Chair Lance Robertson.
Hey Greg, I'm here.
Great. Council Co-Chairs Jaya Lent.
Hi Greg, it's Jaya.
Hey there. Dr. Gibson.
I'm here.
Great. Now our non-federal members going in alphabetical order. Martha Crowther. Dr. Crowther, are you there? Patrick Donovan.
Patrick is here.
Okay. Folks, if you could please double check to make sure that your microphones on your computers or your phones are unmuted. Dr. Crowther. Gail Engel.
I'm here.
Sarah Hedden. Sarah Hedden. Bet Hoxie.
I'm here, thank you.
Dr. Tony Cleckley. Dr. Cleckley, are you online?
No, I'm here.
Great. Yvonne Lee.
I'm here.
Great. Linda Miller. Sharon Olson.
I'm here.
Sarah Smalls. Sarah Smalls, are you online? Charlotte Stevenson.
Present.
Great. Now for our federal partners. Sonia Begay.
Present.
Great. Taffy Compain. Deborah Cox-Roush. Or Joanne Newsom. Dr. Linda Davis. Liliana Hernandez.
Hello, I'm here.
Hi there. Michael Herndon. Amelia Carricker. Helen Lamont. Lisa McGuire. Dr. Ann Matthews-Younds. Tamara Mays. Catherine O'Callaghan. Hopefully folks have their microphones or their phones unmuted. Tammy Proctor. Carmen Sanchez. Mark Vafiatis.
Yes, I'm here, Greg.
Great. Joan Weiss. And Beverly Yang. Okay. Hopefully we'll have more people joining a little bit later.
Hello, this is
yes?
Martha Crowther. I apologize. I'm here.
Okay, great, great. I also want to just take a moment to thank the members of the ACL team who are gathered with us here.
Hi, Greg. I'm here. It's Joan Weiss. Sorry.
Hey, Joan. Okay, how are you?
I'm good. I didn't realize I was muted.
Okay, all right. So we also have with us my amazing team here at ACL. Of course, in addition to Lance Robertson, we have Lori Stahlbaum. who really leads a lot of the work of the Grandparent Advisory Council. We also have our amazing contract support, Cheryl Thompson and Chantal Coleman. I know that they've been in steady communications with all of you as we lead up to this meeting. You're also going to be hearing a little bit later, I'll be more formally introducing Wilma Brockington Parker. She is our meeting facilitator for a good portion of the meeting, and we are so excited to have Wilma working with us. And then I would also like to take a moment to introduce the newest member of the ACL team, Sarah Markell. Sarah is just winding up her second week with ACL. And Sarah is going to be supporting a lot of the writing work that we do as part of the Advisory Council to support grandparents raising grandchildren, as well as the Raise Family Caregiving Advisory Council. Sarah, can I just put you on the spot for like 1 minute to just say hello and do a brief introduction of yourself? I know I saw you there.
Greg, thank you
Yeah.
so much. Yes, can you hear me?
We sure can.
Yes, so hello everyone. My name is Sarah Markell, and I'm a health policy writer, editor by trade, and have recently joined ACL, and I'm very much looking forward to working with you all to develop your report to Congress and then subsequent reports and other communications materials we can roll out to promote the awareness and assistance for and to grandparents raising grandchildren. Over the coming months, I'll be reaching out to some of you for assistance with writing or feedback on various pieces of the document, and I very much look forward to developing something that can move the ball forward.
Great, thank you, Sarah. Before we get into the heart of the agenda, of course, I wanted to turn the microphone over to ACL Administrator and Council Chair Lance Robertson to welcome you all and to say a few words. Mr. Robinson, go ahead, please.
All right, great. Can you hear me?
Yes, we can.
All right, outstanding. Hello to everyone, and thanks so much for being part of today's Grandparent Advisory Council membership meeting. Obviously, it's an honor to have all of you on. Thanks for a bit of your time on this Thursday, and certainly want to just thank you again for your commitment, particularly during this very unique time. I know that all of us, regardless of our respective professions, have certainly been impacted personally. I suspect all of us as well professionally, and I'm just so grateful for, you know, the great work of the ACL team as we continue to advance on important causes such as this one. So thanks to Greg and his leadership and the other ACL colleagues that Greg pointed out. And as we all know now, really more than ever, our efforts to ensure that grandparents and older relative caregivers know about and have access to the right services and supports, it's as critical again now as ever. So we are certainly in an unprecedented time, and our nation's response to the impact of COVID-19 is occurring at every level within the federal government, as well as on the ground in every state and community. All of us are being tasked to be more creative than ever before, and are going to be called upon to give everything we have as a country to meet the needs of those most directly impacted. Despite all of this, I'm heartened to see the great turnout and participation that we have in this, the second meeting of the Advisory Council to support grandparents raising grandchildren. Unlike the first meeting back in August, this one is being done entirely online, as all of you know, in a virtual environment. And it is reasonable to expect this will be the case for the meetings, at least for the near future. And I want to also take a moment and acknowledge a new federal member that we're glad to have on the council, Taffy Copain from ACF, the Administration on Children and Family here at HHS, who will be serving alongside Commissioner Darling and Sonia Bengay, giving voice to the populations your programs serve, including tribal elders. Since our first meeting in August of 2019 here in DC, I know the Advisory Council to support grandparents raising grandchildren has been hard at work in a number of areas. The subcommittees you formed last summer have been meeting monthly, and I've been regularly briefed by Greg and Lori about all the great things going on, especially as it pertains to the development of the required report to Congress. I know that you have worked really hard on an outline for that report, and it looks like that it will be very substantive and a resource-rich document once it is completed. A key part of the report will include a presentation of promising practices and model programs that we know we can highlight and will hopefully serve as a catalyst for other communities to replicate and model what we know is really working. Another key part of that report will be recommendations for how we can better meet the needs of grand families, as well as for areas where new legislation might be needed to better address the concerns of these families. To help complete those portions of the report, I know this group was instrumental in shaping a request for information that ACL put out in the field last December, which stayed online through February. As I know you know, we got a really tremendous response, and we're happy for that. Over 300 individual responses from grandparents, other relatives, professionals, and other stakeholders who are very interested in what they want to see us put out in a meaningful report with really actionable recommendations. So, for all that work, I want to say nice job and extend my sincerest gratitude to all of you. Of course, we know we're still just in the beginning phases of this and creating the momentum that we know we need to carry us forward. And our meeting today is about getting the council positioned to begin making some decisions. And I think that the agenda that Lori Gregg and council co-chairs, Dr. Gibson and Jaya Lint, have pulled together will do just that. The agenda really came about after we heard from you that as a group, you felt we needed to come together around a common vision, a vision to help guide our work and focus our efforts in a meaningful way. We also heard that you felt that you wanted to come together around a common set of principles to ground your work and ensure it reflects the values that I know each of us brings to this conversation, to our work. So for much of our time today, we're going to have a facilitated discussion led by Wilma Brockington Parker. Wilma is a trained meeting facilitator and will help make sure we reach consensus on a number of fundamental concepts that will help keep us moving forward. And before all that, however, my co-chairs are going to lead you in a discussion around the current situation with respect to COVID-19 and how this group might want to respond to it. And before I turn the agenda back over to Greg and Lori, again, I want to take a moment and share with you what I feel our mission ought to be. When I was thinking about this, I looked to our authorizing legislation for some inspiration. And I think if we keep our mission closely aligned with that legislation, we will be in a better position to make sure we fulfill Congress's intent for our work, as well as come through for grandparents and other relatives and caregivers all across the country. So on the slide that Cheryl's now showing you is a mission statement that I would like for us to work from. It says, the mission of the Advisory Council to support grandparents raising grandchildren. The mission of the Advisory Council to support grandparents raising grandchildren is to identify, promote, coordinate, and disseminate information, resources, and best practices to help grandparents and older relative caregivers of children meet the health, educational, nutritional, and other needs of the children in their care, while maintaining their own physical, mental, and emotional well-being. As part of this vision, all recommendations will consider the needs of members of Native American tribes and families affected by the opioid crisis. And again, that's taken from some of the language that we received via legislation. And if we're successful at identifying all the good that is out there, that's going to be a wonderful thing. And if we disseminate and promote it well, I think we will be well on our way to ensuring that we do our very best for grand families. So as you're considering the vision you want to realize and the guiding principles you adopt, keep our mission, please, in mind. And again, I want to thank all of you for the great work that you do and your support, your commitment. Thank you for giving so generously of your time and your talents to serve on this council. And for your care and compassion, thank you. Together, we really will make a difference for grandparents and other relative caregivers. So again, thanks for a couple minutes of your time to kick off this meeting. And with that, I'm going to turn it over to my colleague, Lori, who's going to walk us through the agenda. Thanks to all.
Lori, are you there? Are you on mute? Okay, perhaps Lori's having some problems with her microphone. Anyway, so on the slide you see, on the screen you see our agenda overview. Go ahead.
Yes?
Oh, Lori, you're there. Okay, you weren't coming through.
Oh, I'm sorry.
Okay.
Thank you. Well, here we are in our first virtual meeting. It's going swimmingly. Thank you, Lance. We appreciate your leadership so much. Greetings, everyone. I'm Lori Stahlbaum. I'm with the Administration for Community Living. I have the great pleasure to work with the Advisory Council to support grandparents raising grandchildren. And I'm really excited about today's meeting. Our subcommittee meetings have been so engaging and productive. I just want to thank everyone for everything you've given to the work of the council so far. As Lance stated, today's meeting and the agenda came about because of what we heard from you in the subcommittee meetings. Last Friday, we sent each of the council members a prep guide with some of information we'll be sharing today, as well as some food for thought, as I call it, questions. I hope you found that information helpful, and I hope it helps to encourage the continued level of engagement and discussion I've come to know so well in our meetings. So before I go over the specifics of the agenda, I just want to point out that you'll notice there are no defined breaks built in. So the reason for that is if you need to, it's a virtual meeting. If you need to step away at any time, please feel free to do so. I know most of you are attending this meeting while being a full-time caregiver. And we understand that some of you may need to step away for longer than you might have planned. But please know we understand and it's okay. We just are so thankful to everyone for joining us, and we do so appreciate you being here with us. So now on to the agenda. As Lance noted, we're going to kick off the meeting with a discussion about COVID-19, focusing on how it's impacting families, as well as discussing what you as a council might be able to do to help inform grandparents or other older relative caregivers raising children, how you might be able to help with this situation during this unprecedented time. We have so many a council full of experts, and Jaya and Dr. Gibson will lead that discussion for you very soon. Following that, we have the 3 key items we hope to discuss and finalize today. We've grouped the 3 items into one large block of time. So as Wilma, our facilitator, will have you move through each of the items as you're ready to move on. And we didn't want to confine it to 10 minutes for this or 15 minutes for that. These are the topics. This is the time frame in which we'll be covering them. And we'll follow your lead, and Wilma will guide through the timing of those items. The 3 key items include reviewing the glossary of terms, which we sent some definitions in the prep guide, for the purpose of establishing our shared definition that we're going to use in the report to Congress and in other forms of communication as a council. It's something we've talked about, wanting to be sure we have a continuity of terms and consistency, so that hope to resolve that today, so we're all grounded in the same talking point. Create and adopt a vision statement. That will help us envision what the future of the council looks like. We know what we're doing now, but where are we also going to go? We've got so many ideas hashing around, and it'll help lead us forward as we continue to do all the great work that's going on right now. And then develop and adopt the guiding principles, as all of these which Lance referenced earlier. The purpose is to guide the council's work as we make some critical decisions about what to include in the report to Congress, as well as providing a framework for other tasks that we've discussed in our subcommittee meetings that we might take on based on our shared core values. All of these new tools will help the council continue this important work and keep all of our activities moving forward, and keep us attuned to the same messaging and in consistent conversation. And before I turn it over to Jaya and Dr. Gibson, I want to let you know 2 logistical things. One, Wilma, our facilitator, may ask us to poll you on a topic or a discussion point. If we do this, a screen will pop up on your computer so you can respond. This is the equivalent to the virtual raising hands. These polls, if we do them, are only for the non-federal council members to respond to. And it's just to kind of get a sense of the progress we're making, and that'll be determined by Wilma, and we'll be ready to do that if she asks us. And it's just a yes, no, so it's quite, just pick your option and it'll tell us what we need to know. And second, just so you're aware, we've already seen some of the learning curve in the virtual large meeting that we're having. But at times when we're going to move from the PowerPoint slide to some working documents where Chantal's going to be taking real-time notes of some of the changes or input you have for the things that we've presented as samples in your preparation guide, and it will be on the PowerPoint slides. Or we may want to show some resource or document that we want to share. There may be a slight delay from the going to from the PowerPoint to the next document. So if you hear us people talking and you're not seeing it happen instantaneously, that's to be expected. So I just wanted to kind of give you that. It may take a few seconds, and it's not anything to worry about if it doesn't happen quickly enough. And that's everything I wanted to touch on today. I hope that's been helpful. And again, I just can't thank everyone enough for being here. I do so love working with all of you. It's just been the most wonderful experience. I just can't say that enough. And I'm looking forward to yet another lively and an engaging discussion from all of you. And I will enjoy so much. And so now, if I may, I would like to turn the meeting over and begin our presentations with Jaya Peterson-Lent and Dr. Ethlyn McQueen-Gibson, our council co-chairs, lead a discussion about COVID-19 and its impact on our families. Thank you.
Thank you, Lori, and thank you to Lance Robertson for your important remarks. What a helpful way to kick off this meeting, and to Greg as well for all of your work and the team for coordinating these efforts. Really appreciate the opportunity to spend some time before we kick off the rest of this meeting talking about our current context, the reality of the impact of COVID-19 on grand families. We at Generations United have been holding a series of Zoom calls and email calls for information to listen to what the field is experiencing in terms of those different groups across the country that are working directly with grand families and from caregivers themselves. And in response to those calls, we've heard a number of themes that have come through. I'm going to walk through some of those themes, and then we'll have an opportunity, and then Dr. Gibson will talk about some of the clinical impact pieces that she's seeing. I'm going to talk about more of the concrete needs that we're seeing come to the surface, and then we'll have a few minutes for discussion so that you all can share what pieces resonate with you, or then what pieces that perhaps we've missed in this overview. But before I do that, I do want to flag two portals for resources from Generations United. We have a COVID-19 page off of our website that has a number of fact sheets, information, and tools that are available to help families. And we also have a series of related resources at grandfamilies.org, which is a website that we co-host. So please feel free to go there and peruse those materials and share them as you find helpful. So the themes that we have seen coming through as we gathered information from the field, top of the list as soon as this hit was the need for food and supplies. Access to food, medicine, and basic supplies without requiring families to leave the home, because of course many of our relatives are older or have underlying health issues, and we're concerned about having greater exposure, and really because they're afraid of getting sick and then not being able to care for the children anymore. So while there were supplies available in the communities, for example, the free school lunches that many kids have, in a number of communities, families were told that they needed to go there and bring the kids with them to pick up the meals. So they were waiting in long lines, having to go to a separate place for themselves and the children to get the food that they need. So those basic supply needs. The other piece is access to accurate information from people, from trusted sources. So we recognize that, and we've seen that some of the grand families are particularly vulnerable to misinformation, of which there is much right now. For example, we know that the stimulus checks that are now starting to move, that there's been a lot of scams. And so we're really emphasizing the importance of don't give out your information. The IRS is not going to contact you. And so making sure that there are trusted people that are communicating with the families about what is needed and what can support them. The other piece is technology, which goes hand in hand with virtual support. So we're finding that internet access and also having computers that work and understanding how to use those computers and other technology to get access to information and support, and also to help the children's distance learning. So that includes everything from the telehealth needs for the caregiver and other family members, supporting the children's learning at home, and reducing social isolation. So I know this group is well aware of the important role that support groups have played for grandparents and other relatives even before the pandemic, that those play a role both in providing mental health and emotional support for families, but also information about where to go to get help, what works. So without those connections that they've typically relied on, families in their most difficult time, feeling even more isolated than normal, really don't have a way to connect in the way that they were before. So we see a real need for virtual support groups to help reduce social isolation and continue those connections between families and to their support. Go to the next slide. Financial assistance, we've seen, like many Americans, that caregivers have lost full and part-time jobs for those that work. But then also there are many, many grand families that use their retirement savings to provide both for their needs, but also for their children's needs. And now they're seeing those savings plummeting. So we're seeing real issues in terms of the financial impact on families. And then a big one is alternative care plans for children. We know that emergency plans are necessary if something were to happen to the grandparent or other relative, and particularly in this context, caregivers are concerned if they become too ill to care for the children or if they die. They need alternative plans for the children. And these families so often come together unexpectedly. They have not had time to plan. That hasn't been the top priority because basic needs have been a top priority, but now they need help planning for where the children will go if they can no longer care for them. They also need help with providing for the children's needs at home, helping support their educational needs at home, but also many of the children have special needs that require special care. And we know that they've often had many supportive services, and all of a sudden those have gone away, and it's all falling on the caregiver to address those special needs. Next slide, please. The other piece we've heard is around managing visitation and relationships with birth parents. So particularly if there's court-ordered visitation that requires in-person visits, what happens now if the relative is concerned that they might risk greater exposure to the virus because they're not familiar with the practices that the birth parent are taking in terms of making sure they reduce their risk of exposure to the virus, but yet they're afraid if they say they won't allow in-person visits, that they're violating a court order. Many of the courts are closed, so how do they manage this? We're also hearing that some of the birth parents are being released early from incarceration and then asking to live with the families. So there's a whole host of challenges in terms of managing the birth parent relationship. And then finally, just the need for kinship navigators. And those navigators can play such a great role in a variety of ways, from delivering services or delivering supplies in some cases, information and referral, helping with planning. They really know how to get to the families that are sometimes not captured in other systems, and they can provide a really key role in supporting them in all of the ways that I've described. But the demand for those services is really skyrocketing, and so they need more support. Then the last place that I'll flag that actually isn't on the slide before I turn it over to Dr. Gibson for this next slide is just a range of issues in terms of interacting with the child welfare system. Some relatives are trying to get licensed and they're seeing delays in that, which means delays in their payment. Some aren't getting the training that was typically provided for them. They're needing to waive training. And so they're entering these caregiving relationships without the full range of supports that they typically get from the child welfare system as well, because those systems are overwhelmed. So with that, I will turn it over to Dr. Gibson to talk a little bit more about some of the clinical issues that these families are facing. Dr. Gibson?
Thank you very much. Good morning or good afternoon, everyone. I was just waiting for this jet to fly over my house. I live right behind Langley Air Force Base, and it just completed flying. So if you hear a little lag, that is why. I'd like to thank everyone from ACL for their ongoing support. And during this section of the presentation, as a adult nurse practitioner, as a faculty member, as a mother and a grandmother, I wanted to be sure that we left you with information that is evidence-based, because we talked about that at the beginning of our presentation. So this slide here will give you actually two references, and I've been seeing in the chat box popping up, where will we have access to these slides? And you will have access to the slides. The very first one actually comes from the Gerontological Society of America, which is one of our foremost organizations that does promote evidence-based practice. And so this one here, many of us are worried that now that we have social distancing and physical separation, will this lead to social isolation? And we don't want that to happen. So we do want you to access this resource that is available to you. And this resource will actually give you some guidance on where does social distancing apply? What happens when you're at school? What happens when you're at church? What even happens when you're at home? I've received lots of phone calls from older family members who said, you know, can I at least have my 5, daughters and sons and grandchildren over for dinner? And so this document would give you some evidence-based guidance around that. It also talks about day-to-day activities so that you're not isolated. You can leave your house, but there does have to be parameters as you leave your home. And in many states, we now have the mandates of wearing a mask. Many people have asked, should I carry gloves? So again, that information is there because we do know that you need to leave your home for some of the basic necessities and for some other activities that are required. This document also will give you some guidance on in your home environment. How do you stay safe? Because once you go out and you come back in, what are some things that are considered high traffic and high touch areas that we want to be sure that we are keeping clean? And then finally, this document will address what does happen if you become ill. And Jaya talk to the fact of, if you're the grandparent and you're the primary caregiver and you do head to the emergency room and you come back home and you are positive, but you did not have to be hospitalized, what should you do? Of course, the hospitals will give you discharge planning guidelines. They will hopefully have home health nurses and nurses from our public health department to check on you. But in the interim, what are some things that you should be doing? So that is the purpose of that document. I will now go to the next document, which comes from the CDC. Many people have been asking, why are we so concerned about grandparents and older adults? Now, we do realize from our council that grandparents is, and we'll talk about terms a little bit later, is a very fluid term. And so we know that grandparents are not all 55 and older. Many of them might be younger. But this document here gives some guidance on people who are 65 and older, and this is from the CDC. So again, if you are sharing information with other grandparents in your circle, this will be an excellent document to share with them. It addresses why we're concerned if older adults or grandparents have chronic lung disease, have serious heart conditions, are immune compromised. And many people don't realize that immune compromised can be something as simple as I'm a smoker. That compromises your immune system. It also talks about the differences if you are obese, if you do have diabetes. Many grandparents may be on dialysis. So chronic kidney disease is an issue, and also liver disease. So the two documents that I just referenced will be available once our slides are there, and you will have the links so that you can actually go to those websites. The next slide. Okay, and then lastly, these are some references that we have shared as professionals amongst ourselves, but again, this gives you some guidance regarding AARP. You see that ACL is listed there. All of our resources from our various gerontological societies, Medicare, Medicaid, the National Council on Aging. So again, we as members of the Leadership for Your Council just wanted to take a few minutes to be able to address just some of the basics about COVID-19, because we're sure that you're becoming very overwhelmed with a lot of information, but we wanted to have some touch points to at least say, these are the reputable sites and sources so that you do have the information that you need. And so with that, I'm going to turn it back over to Jaya.
Thank you so much, Dr. Gibson. So those are some of the observations that we've seen in the field and the questions that have come up in the field. Now we want to spend a few minutes hearing from you. I know we're pushing it a bit on time, but perhaps we can take 5 minutes just to hear from you what resonates with you, if other questions or concerns have come up in your work and your experience. I'm going to go ahead and take questions from those that physically raised their hand on the screen, and Dr. Gibson will be monitoring the questions in the chat box. So I'm going to be just taking a look here. If anybody has any comment, you can either unmute yourself and pipe in or wave your hand and we'll do it. I see Gail Engel. So Gail, go ahead.
I would wanting to know the document that you included, talking about what a grandparent does if they come home from the hospital. They'd like to plan that ahead of time. So does that document have some information that they can read ahead of time so that they're prepared?
I think that question is for Dr. Gibson.
Yes, let me answer that question. I actually serve on a task force for the Commonwealth of Virginia, and we addressed that question today. Every single hospital system has now been apprised of what discharge planning should look like. And so if you as a resident, I live in Hampton, Virginia, would like to have that information, I can call to my local health system and they will have a document that they can share with you to prepare if you are ill and you are sent back home. So you can contact your local health department, and in most of our states, those documents, they are in draft form right now, but should be all available to the public by the end of the month.
Great. Thank you, Dr. Gibson. Do we have other questions from anyone? You can physically raise your hand. I'm trying to scan through here, or just unmute yourself. I see Charlotte Stevenson. Go ahead.
Hi, everybody. I'm in the process right now of homeschooling my grandson who is 9. And I find that the expectations are extremely high as to what can be accomplished. And I don't feel that the school district is at all in touch with a grand family situation. So I'm just throwing that out there to see if there are any suggestions. One thing I wonder about is, could there be at some point sort of a PR campaign that expresses to pediatricians and school districts that there are these situations that need other consideration perhaps. So I'm just going to throw that out there, and thank you very much.
Thank you, Charlotte. Really important point. Certainly a huge concern for all parents, and especially for the extra challenges that grand families are facing. I know that we have seen a number of resources come across our desk in terms of supporting children at home. And Generations United is working on a part 2 to our fact sheet to support grand families in the midst of this, which will include some support tips for supporting your child at home. We've also put together a piece to help folks raise the flag for grand families back home in your community, just to educate local decision makers about the impact on grand families. So I think to the degree that that as advocates, folks can be raising the flag and saying, this is how COVID-19 is affecting grand families. As you're deciding how to provide supports, keep the unique situations of grand families in mind, because we've found that often they're so overwhelmed with all the changes related to COVID-19 that thinking specifically of this particular family is not always on their mind. So I think raising the voice and saying, this would be really helpful to me, this is how I'm really uniquely affected, would be helpful. And that resource that I mentioned that can help with that education is at Generations United's COVID-19 page. And I'm sure there's others.
And
Anyone else have?
This is Dr. Gibson. We had on the chat box that I believe Sonia Begay wanted to have a response to one of the questions related to education.
Great. Go ahead, Sonia. Oh, Sonia, we can't hear you. I think you need to unmute yourself.
Control A.
Okay.
There we go.
Can you hear me? Okay, good
Yes.
deal. One of the things that is very concerning is on grand families and grandparents raising grandchildren on Indian country. One of the things, due to the remoteness of some of the populations on these reservations, there's a concern that they're basically just not getting the basic necessities, but I think it's the communication. The understanding of, especially with my family, that some of them do not have the basic necessities such as running water, electricity, and indoor plumbing. So when they have the children, they can go back to, children will go to the school and have these basic necessities, but when they're brought back home, they're basically back to having the bare necessities of basically nothing. So question being is that I want to know how we can be able to be more proactive in looking at these particular areas, and also with the remoteness to make sure that people have just a basic radio or something where they can understand that there's something going on. As you know, and I'm a tribal member of Navajo Nation, we're having a horrible time right now of a high amount of the COVID virus affecting the families at this point. And I think when I look at where it's acting actually with my family, talking with them, it's because of the no communication, to talk to the elders and say, this is a very, very important thing you need to look at, but they're not seeing the seriousness of it. So you still have multi-generational families, which you'll have grandma, grandkids, maybe uncle, auntie, and somebody else in there. So you have a combination of people in this family, and nobody's really taken the seriousness, which I shouldn't say, but I think it's just basically the communication is not there. So that was one of the concerns I did have. And so I made a long list of stuff, but I think that's one of the things I wanted to bring up to the council this afternoon.
Thank you, Sonia. I think such important points. And I want to acknowledge that if folks have other things to contribute, that you can put them in the chat box. You can also send them to the SGRG email if these questions come up after the call. So we want to continue to get information and feedback. I know we have a limited time right now to be having these exchanges. I do want to acknowledge that there was a suggestion in the chat box that locally there are some programs that provide tutors that can be accessed remotely if there is a if there was an internet connection and computer connection, but if you don't have that, that's another challenge. So there are some volunteer tutoring options that are cropping up around the country. I'm going to move now. I know we have some other hands. Please feel free to put your information in the chat box, but I'm going to move now to the second question. How can the SGRG Advisory Council inform efforts to help grand families impacted by COVID-19 or other national emergencies? And I think the thinking here is that as we're putting this report together to Congress, we are in the COVID-19 context right now, but we do hope that report can be a living document or a document that has a long shelf life. And so let's also be thinking about what can we learn from this to inform other national emergencies and the potential impact on grand families. So what can the council be doing to inform those efforts? If I'm missing somebody, please go ahead and jump in and unmute yourself.
Okay. This is Martha Crawford.
Yes. Go ahead.
Good afternoon, everyone. I feel like part of what we can do as a council, I am grateful for the resources that Generations United and Grand Families have put together, but I feel like not everyone knows how to go to those websites and knows about them. So maybe part of our role as a council is to figure out who our major stakeholders are and then make sure they have that information that they can then share amongst their individual communities. I hope that makes sense.
Just so to have a role in distributing information, right? To make sure that the major different groups have the information and are distributing it to their networks.
Correct.
Yeah. Right.
And I would agree with you, Dr. Crawford. You know, something as simple as, you know, yesterday in Richmond, a very small group came together outside a grocery store. And because the community had no idea of where to find a mask, where to buy gloves, where to get hand sanitizer, various church groups came together, put a small amount of money together with a medical transport team, and they took baggies and they distributed a baggie with 2 masks, 5 pairs of gloves, and a small bottle of hand sanitizer. And community members with kids walked up to the grocery store so they could demonstrate social distancing. And then they could say, well, do I really need to wear a mask? And so a 4th grader remembered what she had seen on a Sesame Street clip, and she was able to communicate that in front of the grocery store while everyone else listened. And so that was a very easy way for the community to learn. And her grandmother was with her, and so she and her grandmother both left with 2 baggies that had a mask and gloves. So something simple like that will make a difference.
Thank you. Really concrete example. Appreciate that. So I'm hearing a key role in elevating resources and elevating the needs and then distributing the information. That's great. I want to acknowledge, it looks like in the chat we had a question about recognizing with the significant numbers of illness and death related to COVID-19, are there resources for end-of-life planning for grand families? We are starting to pull together some of those alternative care planning pieces that we've seen in the field, and that certainly is related to that question, really important. I know that there's a couple of webinars and different opportunities related to grief and loss, which is also related, that we're seeing come across our desk. So I'm happy to flag those and send those to the council. And I think if people have resources they've found that are helpful in terms of planning for their families, if they could share those, pass those along, I think those would be useful to share as well. Let's see if we maybe have just one more comment, and then I know we're over time and we probably need to move on. If there are others.
Jaya?
Yes.
This is Lori. I see there's some questions and answers going through, and I don't know if anyone has this, but maybe in the same place, any phone apps that give an ease of access to resources. And I don't know if there's an answer to that, but I thought it, thinking about emergencies and planning for the future, it's difficult to sometimes know what apps are legitimate, what ones are really going to give you what you need, and people are already busy and enough to have to weed through Google Play Store or whatever the iPhone version is. So I just thought I'd bring that one up because that is
That's
the
a
way.
great question. And that goes back to that trusted source of information question, right? To perhaps to pull together resources that can be trusted on that front. That's something I haven't seen, but certainly something to be noted. I know that we have heard that, you know, families that have cell phones, sometimes they have Medicaid issued cell phones, don't have the capacity to do some of, you know, FaceTime and other things. So even families that do have cell phone access can't always use cell phones in the ways that others can to access information. So there's a technology issue there as well. But for those that do, a list of reliable apps is an interesting idea. I see Dr. Gibson holding hers up.
I do. I do want to recommend that there is one reputable source that I have reviewed within my community, and it was developed by Apple and the CDC. And so very simply, if you go to the App Store and type in COVID-19 screening tool, that is a very reputable and very easy. I mean, you don't have to have an Apple device. It was just developed in collaboration with Apple and the CDC. But that is a very easy device that takes you through screening and then answers some basic questions that will either help lead you to the emergency room or either picking up the phone and calling your primary care provider.
Thank you, Dr. Gibson. Wonderful. Well, this has been a really rich discussion, and I suspect we could probably spend the whole meeting talking about this topic, but recognize that we have a very full agenda. So I'm going to go ahead and turn it back over, I believe, over to our facilitator now to lead the rest of the meeting.
Thank you, Jaya. This is Greg. I just wanted to thank everyone for this incredibly rich discussion, and I completely agree that we probably could do this all afternoon, but I think we've collected so much great information, so many good ideas here, not only in the conversation that occurred, but also through the webinar chat and from the questions, that I think it would be a worthwhile exercise for the ACL team to take a look at all of the information that we collected and what was presented on the slides, and perhaps think about one of the ways that the council, that we could support the council in producing some type of a fact sheet or resource guide or some set of quick links, something like that that could be disseminated in relatively short order, that would be really relevant and useful. And so I think what we would like to do, what I would like to suggest, is that following this meeting, that my team and I pull together and see where we could have the most impact, and then we will run these ideas past the members of the council. And I'm also seeing a number of questions in the Zoom chat, the webinar chat, about when will these slides be posted, and the answer is yes. We will be posting the slides and all of this information on the ACL Supporting Grandparents Raising Grandchildren webpage in just a few days. The slides, the resources, a recording of this webinar will be made available to everyone. So if you've missed part of it, you'll be able to catch up on everything. So we want to move to the next portion of the agenda, which will be the remainder of the meeting, and that's a facilitated discussion around those three broad topic areas. And we're very, very excited to have a wonderful new facilitator, Wilma Brockington Parker, who will be leading the conversation and will be guiding the council members through the discussion and hopefully help us reach some consensus and some decisions on a couple of key points. Wilma is a certified professional and executive coach, a training and organizational development professional, and a member of the International Coach Federation. She leverages her formal coach training over 20 years of practical experience to demonstrate impactful coaching linked to results. Her own successful application of process improvement, operational efficiencies, and program management allow her to understand the challenges faced by her coaching clients. And I can attest to that. In just the short time that Wilma's been working with our team, she has really dug into the issues that we're facing, that face grandparents and older relatives. And I think she will be, just a wonderful facilitator for our discussion today. She earned an MBA and an MS in Human Resources from the University of Maryland Global Campus, and has a graduate certificate in Professional and Executive Coaching from the University of Texas at Dallas. So without any further ado, I'm going to turn it over to Wilma to lead us through the remainder of the agenda. Wilma?
Okay. Thank you, Greg, and good afternoon, everyone. I'm delighted to be with you today. So for the next segment for our meeting, we're going to go through the discussion of the glossary of terms. We're also going to create and adopt a vision statement, so we'll talk quite a bit about that. And also, finally, we'll wrap up with developing and adopting guiding principles. So as Lori mentioned earlier during the meeting, there may be an occasion in which we will ask you to participate in polls, and that's going to be for our non-federal council members. And also when speaking, be sure to identify yourself so that we can be able to have the robust conversation. Hopefully you had the opportunity to, I'll quote unquote, do your homework and spend some time reviewing the preparation guide. So we'll refer to the information that was in the guide to help us move forward in making a few decisions. Okay, all right. So our first segment is in reference to the glossary of terms discussion. So as you recall from your prep guide, the council needs to review and adopt a consistent term to be used for the report to Congress. So that's going to represent the population of caregivers correlated to the mission. So this finalized term will be used in conjunction with how you communicate, and that could be verbally as well as in writing, your vision as well as the guiding principles. So once you're able to agree on a consistent term, we want to start using it. This is what was included in the guide. So by all means, this is not an all-inclusive list, but we wanted to point out some of the terms that are out in the field. So we had that list. So the specific terms, again, we want to walk away with a consistent term, maybe even a couple of terms that the council will want to use primarily in communicating. Okay. So we go on to the next slide. So in your guide, you recognize our graph here. And what we want to do at this point is, in our discussion, is really considering the definitions for terms in the graph. What specific term do you suggest that the council uses to describe, we'll call it caregiver support? In reference to that, let's start our discussion, and we're going to actually move where Chantel is going to share a screen with us, and we can start our discussion, and she's going to go through and start to encapsulate or record some of those so that we can have further discussion. So again, you'll see our glossary of terms ranging from grandparent, grandfamily, kin, fictive kin, kinship families, relative, caregiver, and kinship care. Just a few of the terms that are out there in the field. So let's start having a discussion about your ideas for a term or terms that will point to what we can use in our communications. So we're looking for that blended, harmonized term. So you can either come on the line. Also, we'll monitor the chat.
This is Gail Ingo from Colorado. I did answer these questions, and how I feel about it is I personally like kinship families or relative caregivers raising children. Relative caregivers raising children or relative kin raising children. Relative caregivers is a broad term because relatives are also taking care of their older adults. So I would be careful to just use relative caregivers might not work. Non-related fiction kin, I don't feel they don't feel like they are part of the kinship care providers. Aunts and uncles don't like the word grand families because they feel that they're not part of a grandparent, grand family. Also, child welfare uses the term certified care provider, certified kin provider, as a foster care person, a certified foster parent. So I kind of avoided that term of certified kin. Grandparents seem to dislike caregiver because they don't like to be considered a caregiver. They like to be a parent. So my conclusion was that I felt that relative caregivers raising children was appropriate.
Okay, so relative caregiver raising children. Okay, all right, thank you very much. Who's next?
Hi, this is Yvonne.
Hello, Yvonne.
I was a little bit confused there because I thought you were looking for definitions to define it. So we have a homogenized way of how we look at each one of these definitions, not per se, this is what we call our grandparents and everything, because I'm currently just turning in my dissertation, and I did all these definitions, and all of them are used in one way or another. So are we trying to make one definition?
Yeah,
or
so
are we just trying to define what these terms mean to this organization? So if we use it in our paperwork, if we say kin, what are we saying when we mean kin? Because basically, like in my dissertation, I defined everything I put in there, so when they read them, they understand as they flow through our, whatever we present to the legislation or whatever we present, this is what we mean by this word. This is what we mean by this word. Because I went through and looked at all of them and got a definition and an understanding of all of them. Like kin. Kin can be any type of relative caring for children. They just have to be linked by blood or marriage. That's what kin means to me. Grandfamilies. The definition of grandfamilies is a grandparent-headed household, whether formal or informal. Informal, you know, whether they have formal or informal legalities to this child. Grandparents are actually grandparents. They're a grandparent of a child. Now, fictive kin is somebody that's taking care of a child that has some type of relationship to that child, but it doesn't have to be per se by blood or by marriage. A teacher can be kind of like a fictive kin of a child, you know, the child's being taught by this child, or the mentor can be a fictive kin.
Okay, so Yvonne, for our purposes for today, we did have you as a pre-meeting exercise review some of them. They're not all inclusive per se, but in communicating in the report and to others, we want to, you know, certainly look at those definitions, but come up with one or two terms that we can use as a part of your council to encapsulate who are you, who's your target audience, I'll say, so to speak.
So this is Jaya. It seems like there may be two questions. One question is who are we focusing on with this council? And the other question is, what terms are we going to use? And perhaps the unifying question is, what term are we going to use describing, you know, most of who we're focusing on with this council? But when you look at the legislation, it talks about, you know, grandparents and older caregivers. So that's just grandparents and older relative caregivers, right? And, you know, we haven't even made that distinction, but we may be focusing more on one group, but there may be references to other groups. So I think there's some different questions, you know, who are we focusing on? And then what do terms mean? And I'll just also, you know, we've done some research on the use of terms. It's a really sort of age-old question that could take again, we could have the whole discussion on this. But what we found is that different audiences or different terms resonate with different audiences and in different contexts. So for example, as Gail mentioned, you know, the term grandfamily really is a warm term, so it resonates well with the public because people know what grandparents are, that, you know, so when you're trying to grab somebody's attention to really get a sense of, oh, a grandfamily, this is warm, it's grandparents raising grandchildren, that's wonderful. But if you're an aunt or an uncle, you know, that term may not resonate with you as well. We use the term to be all inclusive, but we recognize, we use kinship and grandfamilies interchangeable, but we recognize that aunts and uncles don't, you know, grandfamily doesn't resonate as well with them. The other piece that we've learned is that the term kinship care tends to resonate well with people in the field, people that are, you know, regularly using social work talk. But when you go to the general public, it's mixed. You know, some people feel like that's a term that's imposed on people. It's a social worky term. So there's no one term that has you know, all of the benefits. So my thought is we might want to grab onto two and use two terms and define them clearly. My instinct is to go with grandfamilies and kinship families. But, you know, I'm very open, and this is such a rich discussion. I really value hearing from everyone.
Thank you, Jaya. So far we have kinship or caregivers, grandfamilies, and again, kinship.
And this is Greg. If I could just interject for a moment, I think part of why we felt this discussion would be so important is because early on, you know, we recognize that there are many different terms to describe essentially very similar situations. And while we wish we could use each one of these terms individually, it becomes increasingly difficult and very difficult to read, as a matter of fact, if you list out all of the possible terms. And so our desire with this particular discussion was to see if we could gel around a couple of terms that everyone would agree on would be how we would describe the relationships that we're talking, while in the report, for example, we would call attention to the fact that there are all of these different terms and this is what they mean. But for our purposes and for our work, we're going to limit the reference to one or two terms that encompass everything else. It comes out of a need for simplicity and clarity, yet we also have to be mindful that we don't inadvertently omit somebody or intentionally leave out. And so this is that delicate balancing act that we're trying to make you all walk. So if that helps at all.
Hi, this is Sonia.
Yes, Sonia.
Hi, this is Sonia Begay. I just want, my Zoom keeps disconnecting, so I'm sorry. Every time I start talking, it just flips out and disconnects. So hopefully I'll keep on. But one of the things I looked at was for kinship care. And one of the identifying factors was there for members of tribes or clans. As far as clans are concerned, it's very instrumental that we understand what the clan systems are for each individual tribe. We have a patrilineal society, we have a matrilineal society. When we look at things of that nature, I think if we could possibly look at what the Indian Child Welfare Act or the National Indian Child Welfare Act Office, how they identify grandparents or kinship care things and things of that nature. So we're consistent in when we address other agencies in regards to the benefit of children or the child. I know with the difficulties that I had with my children is that I would say, these are my children, and they would say, is that your biological children or is it this? But for Native families, we all encompass each other as far as having those children. They could be my grandkids, but they were all my children. But I think it just has to be like something somewhat fine-tuned in a sense. It might be, I know I was listening to what Greg was saying, and we just don't want to reinvent the wheel and make this bigger than it is. But I just thought I'd bring that up just in case as far as terminology is concerned. So that's all I have to say at this point. But thank you.
Yeah, Sonia, just to follow up with you quickly, what specific term would you suggest? You mentioned the Indian Care Act.
Right.
So if we wanted to kind of, basically board that particular term that we could consider as a group.
I think initially just identifiable terms regarding family members, because I think there is a confusion, and when we address Native tribes, we just think that we're all the same, which we are not. So this might be for another discussion, but I thought I'd just bring that up. So as far as the term is concerned, I really don't know at this point. There's a couple terms running in my head, so I'll send them back to you. But I think it's something that we can easily address and have that clarified. So everybody's actually working with the same soundboard. We want to be consistent. I think that's the main thing as far as federal, state, and also tribes are concerned. So.
Okay.
This is Sharon in Minnesota. I would hate to see us not take advantage of the term grandfamilies, in that I know has been years of work put into and kind of crafted around that term. I'd hate to see that lost or somehow not be able to be incorporated or accessed by people that would be reading things from us. I do think, though, in the definition, it should not be left simply as grandparents, a definition for grandfamilies, but the definition maybe should go on and include other relatives. Just a simple addition to that, to the grandparents.
So Sharon, I'm hearing you say at least look at two terms.
I think I also lean toward the kinship.
Kinship.
That's something else that we hear out there, but more and more, I think people are accepting the grandfamilies, and there again with Generations United having the grandfamilies.org as a tool for to keep people updated on legislation and different laws, that type of thing. I just think that if we don't use grandfamilies in some way in our communications here, we're going to lose some of that. We could lose some of the work that has already been accepted and accessed by a number of people out in the community.
Thank you, Sharon.
Hello, this is Yvonne again. I see where we're going with this. Well, I'm in support of grandfamilies too. I'm in support of grandfamilies, and I think what I was just hearing is, in using the word grandfamilies in the terminology to define what grandfamilies are, she has wanted us to say grandfamilies are grandparent or any other older relatives that is caring for children, whether they have formal or informal care, and then use the terminology to include older relatives, or older relatives, so they can be included in that, whether it's an older aunt or that the child refers to as a grandparent, because we have a lot of children that refer to their aunts, their older aunts, as their grandparents, because their older aunts raised their mother or their older aunts raised their father. So what I'm hearing is we want to keep the word grandfamilies, and I do agree, because it goes inconsistent throughout my whole dissertation. And I do like kinship care, because in kinship care can relate to other kins outside of your grandparent that's caring for grandkids. But I think I would agree that we need to include the terminology, because we include the terminology of older relatives, headed households caring for children, whether it be their grandchild, niece, or nephew that refers to them as a grandparent, can be considered a grandfamilies. I think people will be more susceptible to that definition, because I do have a lot of people that have reached out to me in my organization, because it says grandfamilies and we were only helping grandparents, that they were 80 years old and these children referred to them as grandparents, but they were aunt, or a great aunt or things like that, or the great great grandmother or something like that. So for me, I would agree. I like the terminology. I like the word grandfamilies. That is my number one pick. And I'm also would like to include in the definition to include grandparents and other older relatives that are caring for children that refer to them as a grandparent rather. And then also kinship care. I do agree that because for legalities, kinship care is, because I come out of CPS, kinship is defined in policy. And so we want to be able to keep kinship in there as well. So those are the two that I would agree upon.
Okay, thank you, Yvonne. So as I'm reviewing, I see grandparents and kinship care getting some additional feedback. Anyone else?
Hi, Patrick.
Oh,
Oops. Hello, can you hear me okay?
yes, Patrick.
Okay, I just wanted to kind of throw out there, and I'm in Ohio here, and with us being a federal council and making recommendations at a federal level, I think we just need to also keep in mind the Family First Prevention Services Act and what they've done as far as looking at kinship navigators. So if I were going to pick one, I think as far as looking at inclusion and making sure that the term that we're using is including as many kinship caregivers as you can, I would tend to lean more toward either kinship families or kinship care. Again, I know that there's been a lot of legislation, not only at state levels, but also at the national level, that uses the word kinship. And I feel like it tends to not omit families that are kinship caregivers. And again, I just think that with the Family and First Prevention Services Act and the Kinship Navigator piece, that the word kinship ought to be in there, whether it's kinship families or kinship care.
Thank you, Patrick. And again, when we think about these terms, we want to make sure that, as a council, that the term resonates, it's inclusive, and you want to get a certain feeling when you hear the term, the terms that you want to use. Okay. Any other feedback?
Yes, this is Martha Crother. I agree. I personally like using the terms interchangeably, grand families and kinship care, in part based on all the discussion we're having. Those two terms seem to resonate with almost everyone, one term or the other or both. So we can just kind of start, I guess, our document with a working definition so that everyone knows we'll be using those two terms interchangeably. Just my thought. However, I want to, Yvonne mentioned kind of older adults, and I know some grandparents are not considered older adults, so I want us to be careful about including that as part of our definition. I've worked with grandparents as young as 29, actually, in my clinical work. So I just want to make sure we we include grandparents range our adult lifespan, not just those over 65.
Okay, so I'm hearing when we go to definitions, we aren't limiting grandparents to an older population so that we have that inclusiveness. Okay, great. Great. Okay, and checking our time, any other comments? We're gonna move to a quick poll, but I wanna make sure that if you wanted to say something in addition to what the two that we have so far, grandparents and kinship care, that we're feeling okay about that.
I just have one question. So as we're talking about those definitions, are folks in agreement that those would be inclusive of those others? I think that was laid out in your list of definitions, but that kinship care would also include others with familial-like relationships, such as godparents, etc. I'm not sure we dug in too much on that, so just right to raise that question before we wrap.
This is Gail. Yes, thank you for bringing that up, because I hear a lot of that. We have a lot of step grandparents and those that don't have blood relationship, those that are adopted. I think those people feel like they're not included as well.
I'm not sure. I work with several grandparents who are actually the step grandparents and they're the primary caregiver. They've not ever, they actually like kind of being perceived as part of the family system. Your point is well taken, but I don't know.
I agree with you. There's a lot that do feel that that's important, but the question has come up with some of the grandparents. I don't think it's a broad concern, but I think there is some concern occasionally.
So I think I'm in full agreement with using the term kinship care or kinship families and grand families. I like those two. I just, as we land on the final definition, I would recommend being inclusive of those that aren't blood related, but are close, have a familial like relationship.
This is Lori. I think as we've talked about in the subcommittee meetings, when we settle on the terms, then we'll need to make sure we're, as you say, Jai, we're inclusive, that we're clear what we mean by the terms that we are using. And we've discussed that we would identify existing terms and then clarify that for the sake of the council's work, we are using these terms to mean these groups of people, these multiple groups of people, or to be inclusive of these people, these types of families. Something just to think about as we're going through a lot of great discussion.
And this is Yvonne again. I would like, even though we use those two terminologies, to also address the fact that because why we're here is being in support of grandparents raising grandchildren. When I think of a grand family, I think of somebody that needs my help, because in kinship care, they come through policy and they've already have access to more funding. They go through the foster care systems because it's written in policy. When I think of grand families, I think of them as needing support, needing some access to resources because they've obtained their children some type of informal way, or they got dropped off on their porch. So even in the definition, as we go through and use them interchangeably, because of policy, identify the ones, because kinship, because I have grandparents that are getting $600 and something a month here because they went through Pride and they did all this. But my grandfamilies, they're not getting this type of money because it's not written into policy. And so if they do get anything for them, it may be a $200 kin check. It's called a kinship check. But and so I mean, and make a reference to that too. So as we go through and we use these words interchangeably, how we present them to legislation to do the asking of what our vision is for these two types of families. And that's all I would want to include in there as well.
Okay, great. So we definitely need to, once we define the terms that we're going to use, definitely have a definition so that if we have to reference back, we know exactly what we're referencing and we're communicating accurately. Okay, just going to pause for a moment. Chantel, who is our stenographer, do you need to catch up or are you okay for now?
Hi, Wilma, just go ahead and direct me if you'd like me to go back to the PowerPoint.
Okay, just wanted to make sure you felt that your notes were up to date. All right, so let's do, we'll move to our poll. Unless there are any other suggestions. So we're looking at grand family and kinship care. Do you agree with those two terms? And what you'll do is click a yes or a no. See where we are, and that'll be our non-federal council members. And then once you click hit submit, we'll be able to see where we are with those two terms. I'll give you a few seconds or so.
This is Gail. I cannot click on anything. It's not letting me do anything.
Me either.
Me neither. I have the same experience.
It's hosts and panelists can't vote. I guess, are we panelists?
Actually, hi, this is Lori. Yeah, I see we had this once before. I don't know why it happened, but it happened again. It's saying that hosts and panelists cannot vote, which is the opposite of what it should be.
Okay, we will check that right now, and I will end that. And so we have the public comment on that, and we will change that.
Sorry about that. Thank you. Just one moment.
Okay, just 1 second.
Thank you, Cheryl. Okay, so look, we have the poll showing. And again, do you agree with the terms that we've discussed, grand family and kinship care? Select your response and then hit the submit button. And then we'll be able to see where we are. Okay. So as a result, it appears that everyone has voted and we're showing at 100%. Okay. So going forward, we will use our new terms.
And this is Greg, if I can just interject, thank you for this. We recognize fully, and Sarah Markell and I have been chatting offline here. We fully recognize that we're probably going to have to very accurately and thoroughly document the discussion. This discussion about how we came to agreement on these terms, that's going to have to be part of the report. So that readers of it, whether it's members of Congress or stakeholders or grandparents and older relatives themselves, understand the thinking behind the choice of the terms that would be used moving forward. So I just wanted to put that out there to let folks know that it's not a this or that or one thing only, but it will be, we will explain it and make sure that it's clear how we got to where we are.
Okay. Thanks so much, Greg. Okay. So back to our PowerPoint, we're moving on to our next segment for our meeting today. So in this segment, we want to create and adopt a solid vision statement. And we'll just on the next slide, just a quick view of the mission statement. So this is what Lance had reviewed earlier, and it was also included as a part of the prep wrap. So when we look at a mission statement, we can define it as a short statement that tells others who read it, why an organization exists, what is their overall goal. It identifies its operations and the type of, in this case, a service it provides. And also it identifies the people that you want to reach as well as impact. So really the council's mission and the vision should go hand in hand. So when we move on and we talk about the vision statement, how are we defining that? So when we make reference to the council's vision statement, we want to identify it as the picture that is crafted today of what the council's future will look like. So essentially by working with and listening to those with an interest, you'll acquire an understanding of what services are wanted and also the issues of concern. So keep those things in mind when you're starting to really create and formulate this vision statement. So I thought it would be helpful to just take a brief look at a few examples of vision statements for two organizations, New Pathways and the Family Connection Center. So New Pathways is an organization, nonprofit organization that's in the Mid-Atlantic, and their target population that they assist are youth 16 to 24 who are transitioning from the foster care system. So with New Pathways, their vision, at New Pathways, we believe that given the chance, young people are the key to thriving economies and a vibrant future for us all. And we'll do everything we can to help them get there. For the Family Connection Center, families we serve will continue to have access to multicultural, multilingual resources and neighborhood support services that provide opportunities for community-driven initiatives and strengthening individual skills to create a safer, healthier, and empowered community in which to raise children. So hopefully in reviewing these two examples, you get a good feeling about these organizations and what they like to see for the groups that they serve. So I'll pause for a moment and ask if there are any questions so far about, what a vision statement is and what it should accomplish before we go to the checklist. Okay. So during this process for crafting a vision statement, we'll be using this vision statement checklist to help you create a vision statement that's going to resonate with you as well as others. And what you want to do is walk away with a vision statement that really hits home and really one that you're going to be very proud of. So in looking at our checklist, our first question, does the vision statement provide a clear picture of the council's future? Number 2, is the vision statement challenging as well as inspiring? Number 3, is the vision statement believable? And number 4, will achieving the vision positively add to our overall mission? Okay. All right. So on the next slide, you'll see a working draft of the vision statement. And this is essentially to give us a running start. So it reads as the Advisory Council to support grandparents raising grandchildren will be an authoritative leader for identifying and creating best practices to support and advocate. And we're going to use our new term, grand families and kinship care. We will serve to create better tomorrows for families today. So with that, we're going to transition to our Word document where Chantel's going to capture some of your thoughts. So as she moves us, want to hear what are your initial thoughts in the draft based on the draft statement. And, I want to hear about, your input, what it is that, what's missing for you, perhaps what you'd like to see added. And we're going to go back to the questions to make sure that it's going to be a statement that accurately reflects the council's future and something, again, that you'll be very proud of. Okay, you can come on the line.
Wilma?
Yes.
This is Lori. Charlotte Stevenson of the council. I'm not sure if she doesn't have audio. Okay. Charlotte, are you?
I do, Lori. I'm just, I don't know. I thought
chatting too?
Yes. But I will certainly speak if that's okay.
Okay, absolutely.
Okay.
Oh, yes, that was what I was going to speak for you, but I prefer you speak for yourself. Thank you.
Okay, yes. So I chatted out. I just made, I liked what was there so far. I made the minor change of removing an authoritative leader. I'm not sure that was really necessary, but specifically it says, the Advisory Council to support grandparents raising grandchildren, SGRG, will develop best practices to support and advocate for grandfamilies and other older kinship caregivers. We will serve to create better tomorrows for children today. In my mind, this is really about the kids. They're being raised by other people, and those people need support to do the best job possible for those children. So those were my ideas. And I don't know if I'm saying this correctly with the kinship caregivers. I'm still not settled on whether we're addressing the older component of this process or are we just leaving it open to everyone? But anyway, I put it on chat. Those were my suggestions. And thank you.
Okay, thank you, Charlotte. Okay, so in our notes, we have the suggestion of removing an authoritative leader, and also the addition of SGRG will develop best practices for grand families and other, I believe you said, Charlotte, older caregivers.
Yes, I said, and other older kinship
caregivers, okay.
We're using those two terms, correct?
That is correct.
Okay. Thank you.
Okay, thank you.
Gail.
Okay, Gail, yes.
I agree with Charlotte. I didn't have authoritative leader, but the thing that I did was I went back and looked at some of the comments of what people felt, and so this is what I came up with as an added statement. We will bring bold understanding to the needs and value of our relative caregivers or grandparents, however we determine that, and assure that they are treated with respect and dignity, with consideration of their culture, to assure that their families may flourish.
I like that. This is Yvonne. I like that because the first one I understand, you can take out authoritative leaders because I don't have to be called an authoritative leader. Our vision doesn't have to include that in everything because we kind of all know where our specific places are and how we got brought here to carry out this vision. But I would be inclusive of adding culture for the diversity. Also, I don't want to focus on the children. She says take out families. The first one said take out families. I said leave families in because we want to be inclusive of the elderly people that are caring for these children. Because I just finished doing a research project on the health of the grandparents. I know we're focusing on children, but we also have to focus on those grandparents because our grandparents are a vulnerable population because they are taking in these children into their homes with these health risks, and they're having all these worries because the children actually have policy that follows the children. Our grandparents do not have things in place to care for these children. So with that, so the Advisory Council to support grandparents raising grandchildren I like that. I like the statement when she said a bold and everything. And I think we should do grand families and the kinship care and use that bold statement that the second, I didn't write it down, you guys have it, but we have to keep families in there, not just focus on children. The first one took out families and said she wanted to focus on children. I think in us focusing on families, these grand families are all inclusive of everybody in the home.
Okay. We definitely want to reflect
that. And I agree with Yvonne in terms of the value of the word families.
This is Greg. There was I can't remember if it was Gail or perhaps Sharon before read a complete statement. Would it be possible for whoever it was to repeat that so that we can get it down?
Yeah, that was me. And
okay.
I will read it to you again.
Okay.
We will bring bold understanding to the needs and values of our relative caregivers. And you can say it however it needs to be.
Okay.
And assure that they are treated with respect and dignity, with consideration to their culture, to assure that their families may flourish.
Yes, I like that.
Chantal, can you move your screen up just a little bit? Thank you.
This is Jaya. Really rich discussion. I had a suggestion for earlier, and it talks about the role for identifying and creating best practices. And I don't think our council is creating the practices. I would replace that with either elevating or sharing. I think we're identifying and elevating practices or sharing practices?
This is Amelia Carricker from NIA. I'm glad you brought that up, Jaya, because Connie and Lori and I were talking about that. I mean, it seemed like rather than talking about best practices, to us, it's sort of, I don't want to speak for everybody, but it seems to me unclear in terms of what best practices actually meant. I mean, this is meant to be a resource really for, that's one of the major purposes of this. I mean, I don't know how other people would react to that, but that was sort of my feeling. The best practices also feels kind of prescriptive.
I think that's a really good point, because those terms, best practices, even promising practices, those all have really defined terms. There's a whole clearinghouse that goes through a really rigorous review process to identify what's a promising practice, for example, and best practice, you know, is used in certain contexts to mean something really specific. It's hard to know what the right word is. You know, you could go with effective. That probably has its own term, but.
Okay. Do you
this
feel
is loaded word?
If I could also point out a distinction too, you know, there's from ACL's perspective, you know, we spend a lot of time and resources to promote the replication of evidence-based interventions that oftentimes have their root in emerging best or model promising practices. And so there's this, it's an entire continuum all the way from a great idea to something that's evidence-based and everything in between. So we may need to exercise a little caution in getting too specific, and that's where maybe the term resources, which could then be anything, you know, would be more applicable. Just something to keep in mind.
Okay. So from the conversation so far, I'm hearing that, you know, having that term best practices may cause a little bit more confusion, or it seems very structured when part of the goal is expressing on resources.
Oh, shoot. Greg? Maybe when we were at the Native American Grantee Conference with Sonia, or Sonia maybe remember, there was a young man who used the term like something about modeling. Sorry, I should have like probably chatted that for you. But it's a really good term, and we like that kind of it encompasses things that could prove to be promising practices, but are showing promise, but not in the educational, you know, scientific background or federal background, not quite yet a promising practice, or an evidence base, but it's been consistently successful. And those kind of things are resources we would also want to share. That program they were running in Minnesota with the youth, the Native youth who were being raised by grandparents.
Yeah, I cannot remember the term, and I do recall it was a good one.
I remember we really liked it. I'm sorry to put you on the spot on national television. But I put myself on the spot too, because I can't remember it either, but it's in our notes. We'll find it.
Okay. Thanks, Lori.
This
and Greg.
Sharon, I'm wondering a little bit why we're kind of backing up when we're adding the word older in front of kinship caregivers. Weren't we going to just address that in the definitions and keep our identifying grand families and kinship caregivers, just focusing on those so that people were not feeling left out?
Mm-hmm.
Okay, so take out that out so that we're still remaining inclusive.
The older, I think I see it a couple of times there, and I just don't think it adds anything.
Okay, thank you. All right, so we've done some updated. Additional comments? Okay, so we can, I'm sorry, I think I heard someone.
Oh, so this is Greg. So I was going to say, you know, it looks like above the line there we have a lot of edits to the original, to the sample or the draft vision statement, and then we have the beginnings of a revised vision statement that a lot of people seem to be gelling around. The sentence that begins, the SGRG will bring bold understanding. So does somebody want to take, or a couple of us want to, or you want to take a stab at combining the two into a single statement that you all think reflect, that could serve as this group's North Star?
So we can start with the beginning.
Mm-hmm.
Okay, so the Advisory Council to support grandparents raising grandchildren will go down to, will bring bold understanding to the needs and values of our relative caregivers and ensure that they are treated with respect and dignity, with consideration to their culture.
Hi, Wilma, it's Chantal. Can you backtrack to bold understanding to the needs and values of? I'm sorry about that.
Yep, yeah, right above, we're basically reading, it's not a paragraph,
Okay.
but a little further down. So I'll start again, where it says, will bring bold understanding to the needs and values. Yep, copy that, yep.
This is Lori. I think based on the previous discussion, instead of our relative caregivers, would it then be grand families and other
Kinship.
caregivers?
Correct.
Just to start working
our terms, yes. Okay, to ensure that they are treated with respect and dignity. Then we need to go back up a little bit.
Maybe you could put that just onto one page, Chantal, what you just typed, so that it can see it all together. Just Control Enter. Okay.
And then we can go back to add, we will serve to create better tomorrows for families today, because families will be our all-inclusive term.
This is bad. This is a small thing, but I would take the word our out of there. Our grand families. We don't own them.
Okay.
Just have it be grand families.
Grand families. Okay.
Mm-hmm.
Okay. So let's read it again. The Advisory Council to support grandparents raising grandchildren will bring bold understanding to the needs and values of grand families and kinship caregivers to ensure that they are treated with respect and dignity, with consideration to their culture, to ensure that families may flourish. We will serve to create better tomorrows for families today. Okay. Anything to add?
We may need to, and this is just looking at it from a grammar perspective, we may need to whittle that down without losing any of the great material or even the nuance that's here, to make it a bit less of a run-on sentence in that first one.
That's why Sarah's here.
I know. Yeah.
This is Gail. So exactly, when I was kind of wording this, I did not, I left in that first sentence and started a new sentence when I was talking about that bold section. So keeping in the Advisory Council to support grandparents raising grandchildren will be an, and whatever that, a support and advocate for grandparents. I thought that was one sentence and then starting a new sentence.
So Chantal, scroll down a little bit back to the revised statement, and we're gonna turn that into 2 sentences. So we'll say the Advisory Council to support grandparents raising grandchildren will bring bold understanding to the needs and values of grand families and kinship caregivers, period.
Excuse me, Wilma?
Yeah.
Or
Yes.
Gail? Maybe it's Gail. I thought I heard Gail to say, and I'm sorry if I misunderstood Gail, that the opening sentence of the sample vision you were considering as included will be something for identifying and sharing resources to support and advocate.
So we've kind of changed things a little bit, but when I was working through this on my own, I was thinking the Advisory Council to support grandparents raising grandchildren will be an authoritative leader for identifying and creating practices for support and advocacy for the needs of caregivers. I left that in there, and now you have all kind of revamped that sentence, but that would have been the first sentence. The second sentence would start out with, "We will bring bold understanding."
Thank you. I thought there was a connection with the original sample and thank you for clarifying.
This is Sharon, and Gail, I like leaving that in, but I was wondering if we couldn't say that the council is a leader. I mean, I think that we do need to be seen and identified that we have accepted this role and are willing to put our efforts into this, and we should be looked to as the leader identifying these things. So we don't maybe need authoritative, but actually leaving leader does not sound bad to me at all.
Thank you, Sharon.
Yeah.
With you.
Yeah. Okay, so we'll experiment with leaving leader in. Think about your audience. How do you want them to feel about the council? So using those descriptive words can certainly help us project how we want people to feel when they read that vision.
Also, I agree with I think a note I see in the chat, and that is that it says grand families and kinship caregivers. I think it would be in kinship families, right?
As the term, yes.
Because we're talking about the full family.
So for readability, would we then just want to switch kinship and grand families so we could say kinship and grand families? Or are they two separate things? Does the use of the word families twice so close together matter?
Thoughts?
This is Charlotte. Yes, I agree with Greg. I think we only need families in there once. So kinship and grand families make sense.
Okay.
Mm-hmm.
This is Patrick. I agree with that as well.
Now, in looking at the term bold understanding, do we need further definition on that? Or how are you feeling about that?
So this is Greg again. In the earlier chat, somebody suggested removing bold leadership, and I think was raising awareness. Or I think that was, I'm trying to scroll back up.
Hi, Greg, this is Liliana. I think that was my suggestion, either increasing awareness or raising awareness instead of bold understanding.
Yeah, something like that. Whoever it was that suggested that, I don't know what folks think about. I just wanted to make sure that that was on the table.
Additional thoughts about replacing bold with increasing awareness?
I'm in agreement.
And understanding. Any other thoughts? Okay, let's go back and read again. I'm sorry, Chantal, go ahead and do what you need to do. And then we'll go back down.
Hi, Wilma. Can we clarify, going back to the original vision statement where it says will be a leader for identifying, and are we replacing elevating or sharing with supporting?
Let's see, let's get some feedback on that.
Chantal, why don't you just copy that whole first sentence down in with the new working draft, and we'll clean it up from the input. As Wilma said, we'll get some feedback on that, and we'll just bring it all together so people can see it and then comment. Excuse me, Wilma.
Oh, no problem.
Thank you, Chantal.
Okay, just doing a little bit of cleanup. And we'll reread it and get a little bit more feedback.
And Wilma, this is Sarah Markell. I just want to flag that maybe we want to take a moment to focus on the pronoun their families right before may flourish. It's not clear whose families we're talking about at that point. So we may want to just turn it around a little bit and think about their respective families or all families or families across the nation or something to clarify that, but that's a minor point.
Okay, so some thoughts on going back to the audience. Any other some additional feedback?
I think it should say these families, not their families.
You said these families, Gail? Okay.
That works.
Okay. Okay, so we will increase these families, we will increase awareness and understanding of the needs and values of grandfamilies and kinship. Okay, we have a few things that are running on. Let me start from the top and then we'll get it in. The Advisory Council to support grandparents raising children will be a leader for identifying and elevating or sharing resources to support and advocate for grandfamilies and kinship families. And we wanted to kind of fit that together, kinship and grandfamilies. We will increase awareness and understanding of the needs and values of grandfamilies and kinship, kind of doubling up there. So we need to do something with that. Wait until you catch up a little bit.
That's where we could use the first these families to ensure. To ensure that they flourish.
Kinship, whatever our two terms were, grandfamilies and kinship. Caregivers or just
kinship families.
Kinship and grandfamilies.
So we have to leave families there because we're identifying the who.
I thought we had agreed that we were going to switch kinship and grandfamilies and just say kinship and grandfamilies so that we have,
So that we aren't repeating families twice. Right. Yes.
Sounds better. And then the second one, the next instance becomes these families.
Right.
And then the final one is they.
Not there.
That works.
Not there. Back up to where it says before grandfamilies, values of.
Okay, we will increase awareness and understanding of the needs and values of these families. Right.
Yeah, to ensure.
To ensure. they are treated with respect and dignity.
Let's see. Okay. All right. And then our final sentence, we will serve to create better tomorrows for families today.
I have one question. This is Gail, I'm sorry. Are we really going to be sharing resources?
Yes, this is Greg. So that's actually one of the basic tenets of the Supporting Grandparents Raising Grandchildren Act, is that, you know, the Grandparent Council, in partnership with other stakeholders like federal and other sectors, would share resources that are identified. So. Mm-hmm.
Okay.
So I think up there we could do either elevating and sharing, or we maybe could drop, but I don't think we want or. I think we would.
From my way past experiences here, but Gail, I really appreciate that you did emphasize the respect part of it. Many, many years ago, we had something we called the 3 R's, which addressed what caregivers wanted, which were resources, of course, and they included respite in there. But one of the main things was respect. And I just really appreciate that that's a part of the statement.
Hello, and this is Yvonne. It's just one thing, you guys are doing wonderful. It's just one thing that it kept resonating with me. On that last sentence, we will serve to create a better today for families tomorrow. I think we should put today before tomorrow. So we will serve to create a better today for families tomorrow, instead of we will create today for families. Yeah, we will create better today for families tomorrow. I think that flows better.
I agree. I also want you to look at kinship and grandparents in the 3rd sentence. Kinship is capitalized.
Oh yeah, that's a word. That's like just a little wordsmith thing.
Okay, so we'll make that lowercase. Okay.
This is Sarah. I just want to flag that we have the verb form to ensure twice in one sentence there. And while it's great, we may want to just say something like after, with respect and dignity, with consideration to their culture, so that these families may flourish or can flourish.
This is Bat. Can you hear me?
Yes.
Okay. This is probably small again, but so that the families instead of these families may flourish. And then if we go back to we will increase, perhaps we should just put SGRG, or the SGRG will increase awareness, or attempt to increase awareness.
How do you feel about we versus SGRG, just to get some feedback? How are you feeling about that? Is it resonating? Which one resonates better?
And this is Greg. I'm also seeing a suggestion in the chat where we have support and advocate. Could we, what about the word empower? Support, empower, and advocate.
I like that from a social worker's perspective. Yes, empower.
I like the word empowered.
Right?
I like either way. You were talking about the SGRG or we. I do like SGRG, but I would put SGRG Council. I know it sounds long, but it's the council that is doing this.
Yeah, maybe that's a simplification. Maybe we should just put the council will.
Okay, to replace SGRG. Okay, let's try that. And I would capitalize council in that instance. Okay. Hear how that sound. The Advisory Council to support grandparents raising grandchildren will be a leader for identifying and elevating and sharing resources to support, empower, and advocate for kinship and grandfamilies. The council will increase awareness and understanding of the needs and values of these families to ensure that they are treated with respect and dignity, with consideration to their culture, so that families may flourish. We will serve to create a better today for families tomorrow.
I see a comment in the chat box concerned that the switch of today and tomorrow could make it look like we're putting off helping them. We can't help them today. We're putting it off till tomorrow.
That we're working. So I think
so maybe just remove tomorrow.
Yeah.
Create a better.
Okay, so keep in mind, vision is future. So mission is going to state, you know, what you're doing now, who you're targeting, and then vision is really talking about how you want the council to appear in the future.
Or
we create a better today and tomorrow for families.
Or we will serve to create better futures for families. Create a better future or better futures for families.
A better. It has to be a better. And then also when you want to go up there, right here where you were saying, so that the families, right here, dignity with consideration to their culture, so that families, that the needs to come off, so that families, not that the families.
Yep.
Families. Okay.
Nothing like wordsmithing real time.
That's quite a process. I'm not so sure we need elevating in the first sentence. Will be a leader for identifying and sharing resources to support. I'm not so sure elevating really adds anything to what we're doing, but that's my opinion.
Yeah.
Sort of standing there by itself. It feels like it needs words around it if it's going to stay. Elevating what?
Well, I'm not sure what elevating really means in this case.
That's what I was saying. It's sort of standing alone.
Just remove it.
Yeah, so identifying and sharing.
Right. I think that's what we'll be doing.
Okay.
I also have a comment about advocating for kinship and grand families. Shouldn't we be saying kinship care or more than just kinship? It seems like it needs a qualifier there.
That's why we put kinship and grand families. We're talking about kinship families and grand families.
This is Sharon. I actually would like to see kinship and then grand families also capitalized so that they're identified as a group.
I struggle oftentimes with the same thing as saying kinship families and grand families because we're saying families twice, but we really aren't saying families twice. Grand families is one word. It's, yes, we're describing families, but when we say kinship, we need to identify that it's a kinship family. It's just 2 words. I struggle with it because it's so long, but I also think that it is important that we're identifying that that is a family.
It's just the nature of the beast, maybe, that we have to have that families in there twice and capitalize families.
And it comes back to the respect of the units.
Right, right.
And grammar be darned.
And so and I think we need to plural cultures, make it culture plural so that they're cultures for their cultures so that families may flourish.
Okay. Just looking at our time. I'm going to go back and read again. The Advisory Council to support grandparents raising grandchildren will be a leader for identifying and sharing resources to support, empower, and advocate for kinship families and grand families. The council will increase awareness and understanding of the needs and values of these families to ensure that they are treated with respect and dignity with consideration of their cultures so that families may flourish. We will serve to create a better future for families.
I just have one more correction because I was trying to make this resonate because I teach diversity and social work too. On the consideration of their cultures, it needs to be cultures, values, and diversities so that families may flourish, because all of those will be able to identify their differences. So their cultures, values, and diversities so that families may flourish.
Except for the fact that we also say the needs and values of these families in the fourth or fifth sentence there. So we're now using values again.
Okay.
So we could say will increase awareness and understanding of these families.
Of these families to ensure.
Mm-hmm. And then with consideration of their needs, cultures, values, and diversities. Of the needs. The council will increase awareness and understanding of these families with consideration to,
To their needs, it would be to their needs.
To their needs. And ensure that they are treated with respect and dignity.
We've used consider twice. Consider.
Yeah.
We could, another word you may want to use, but I see it twice in there already, is respect, again, with respect. But we will also have the other
increase awareness and understanding of these families.
This is bad. How about changing it, honoring their cultures, values, and diversity?
Yeah.
So instead of with consideration, yeah, with respect and dignity while honoring.
Mm-hmm.
Honoring cultures, values.
While honoring.
Yeah, in front of honoring.
What about we will serve to create a better future so that families may flourish? And take the flourish part.
Oh, yeah.
And the sentence with diversities. We will serve to create a better future so that families may flourish. No.
No.
Chantal?
I'll add it to the bottom. Don't start another sentence. Go to the last sentence at the end where so that families may flourish.
Delete.
And here's one more suggested edit, because I think we can streamline the wording. So if we go up to where it says the council will increase awareness and understanding of the needs of these families, and then take out with consideration to their needs. and then leave and ensure that they are treated with, so that, yeah, that's.
Okay.
There.
We could even say, we could even stop there with that sentence. The council, I'll just read it. The council will increase awareness and understanding of the needs of these families, period. And then say, by ensuring they are treated with respect and dignity. Wait a minute, I'm sorry. Let me do that again. The council will increase awareness and understanding of the needs of these families and ensure that they are treated with respect and dignity, period. By honoring their cultures, values, and diversities, we will create a better future so that families can flourish.
Yeah.
Trying to divide it up a little bit.
Yeah.
There's a lot of strength in all of the iterations. It's certainly good.
Yeah. So we will, and then just delete serve to. We will create a better future so that families. This is very action oriented.
All right.
And then, yeah, so it's a period after diversities, and then the final sentence will be, we will create a better future so that families can flourish.
And Wilma?
Yes.
The vision statement is action, future. I mean, that is the whole purpose there, right?
Yes. So I'll read this, and then I want us to go back to our core question and make sure it encapsulates what we want the vision to be. Okay.
I say there was one more piece in the chat box that suggests adding the word educate up here on that third line, support, empower, educate.
Support, educate, empower, and advocate for? Jaya?
Yeah, I'm reflecting what was in the chat box. Yeah.
So for people to react to, council members.
Any other comments before I read?
I was just going to say, I think we were trying to divide it up a little bit at the end and say the council will increase awareness and understanding of the needs of these families and ensure that they are treated with respect and dignity, period. And then the new sentence, by honoring cultures, values, and diversities, comma, we will create a better future so that families can flourish. I think that's where we were headed.
Yep, that's it.
Okay. All right, let's take it from the top. The Advisory Council to support grandparents raising grandchildren will be a leader for identifying and sharing resources to support, educate, empower, and advocate for kinship families and grandfamilies. The council will increase awareness and understanding of the needs of these families to ensure that they are treated with respect and dignity. By honoring cultures, values, and diversities, we will create a better future so that families can flourish.
So you read the third line, you said to ensure instead of and ensure. And I think I like to ensure. Well, I think I like that.
To ensure?
I guess, yeah, because that says that's our goal. I don't know that we can guarantee that we're going to ensure that. That's our goal, but I don't think we can guarantee it. Yeah.
Yeah.
So I like that change.
Okay. All right. Let's go to our poll to see where we are as far as agreement. Then we'll move on to our last segment. And of course, reminder, only in reference to who can poll. So do you agree with the vision statement we have discussed? Click yes or no, hit your submit button, and we'll look at our results. And Cheryl's coming up with the poll, and it looks like we're at 100%. So thank you for participating in that segment.
I love this council. You guys are awesome.
I can't believe we did that.
Kudos. Great.
This really is, this is so exciting. I can't tell you. This is really great.
Yeah, I'm sorry. I just got to shout out here because I'm like, oh my God, I love that, but I'm not allowed to vote. Like, yes, it's wonderful. But I didn't say that. Oh, shoot, we're being recorded.
That's okay. All right. So in a few moments, Chantal will take us back to our PowerPoint, and we'll kick off again with our guiding principles, which is our next segment.
Up for one more second, Wilma? I'm so sorry.
Sure, go ahead.
I just want to let the council members know, if they're not looking, there are many people in the chat on the public side, attendee side, who really love that vision statement as well. There's been a lot of chat on the other side, and just kudos coming from all over. I just thought that was pretty neat.
Yeah, great job, great job. So we're going to move on to our guiding principles. So when we look at guiding principles, they're going to assist in helping us also communicate and project. So what are our guiding principles? They are ideas that give a group guidance regarding circumstances, even if the goals change and the work changes. Guiding principles can certainly be critical for framing complex work. They also help to ensure that shared core values are articulated up front and shape results. So these guiding principles are going to assist in reviewing the input that's received for requests for information and other materials for the report to Congress, and any other activities the council may undertake in the future. We're going to move on to the why. So why do we have them? So they're going to allow for focused decisions when developing the outline and report for Congress. They will also assist in reviewing materials to include for the report to Congress. And additionally, they'll provide a foundation for decisions on other activities the council may undertake in the future. So we have our what and our why. And we'll move on to our draft of the guiding principles. And keep in mind, we came up with our two terms, grand families and kinship families, that we're going to use going forward. So prior to this, we created this PowerPoint to show what was in there originally, and we will go on and replace what's in red with the terms that we agreed upon. So we have 5 that we're working with, and I'll review those. So I'll go back, I'll read go back a slide just a moment. I'll just briefly read the 3, and then on the next page, I'll read the additional 2, numbers 4 and 5, and then we'll start our discussion, our robust discussion. So number 1 here, used as grand families and kinship caregivers, used as intertwining terms. So we're gonna do some wordsmithing with that, because we have our terms that are inclusive and holistic, describe families in which children whose parents are not able to raise them are being raised by their grandparents, older relatives, or others. So keep in mind, we will wordsmith. Number 2, promote greater adoption of person and family-centered supports that place grand families and kinship families at the center of every support system, while also acknowledging the challenge of possible conflicting goals. Number 3, efforts to support, and I'll just skip further, their autonomy, choice, and ability to remain engaged and contribute meaningful in their communities. Number 4, recommendations should recognize and support in a fair and impartial manner that also accounts for financial impact, while respecting and appreciating the complexity, diversity, and dignity of these families. And then number 5, ensure that the needs are an integral to National Family Caregiving Strategy, which is being developed by the Family Caregiving Advisory Council. Okay, so those 2 slides, they outline in draft form the 5 guiding principles for the council. We can incorporate the term that we decided on, the 2 terms, grand families and kinship families. So our next step, we want to have a robust discussion about the guiding principles, and our goal is to walk away with some principles that will be used going forward. On the next slide, think about the guiding principles discussions. So these are the 3 questions that we want to be able to answer rather. So are these principles applicable and relevant for our purposes? If not, what do you suggest? Number 2, will these principles help shape and form the report to Congress? If not, what would you add or change? Number 3, are the guiding principles sufficient to shape other activities desired by the council, such as white papers, fact sheets, webinars, and conference presentations? If not, how can we improve? So we're going to have Chantal move us to back to our Word document so that we can capture your thoughts and move us to develop the council's guiding principles. Okay, so for the first one, we're going to replace what's in red with our terms. Okay, and we can certainly wordsmith where we need to make changes. So come on the line. So here we have grand families and kinship families. Here we had originally used as intertwining terms that are inclusive and holistic. Describe families in which children whose parents are not able to raise them are being raised by their grandparents, older relatives, or others. Comments?
Hi, this is Amelia from National Institute on Aging. I really like this, and I wonder if, since it's a principle, if we could sort of have it as a statement, like we recognize or we define grand families and kinship families to include the following, something like that, so that it sort of reads as sort of a statement of our belief as opposed to, but incorporating sort of our understanding of what the definition should incorporate, and that it is inclusive.
Okay. Thanks for that feedback. So we're starting with, so the suggestion is that we'll start with we recognize, and then we're going to define the grand families and kinship families, and also that describe families in which children whose parents are not able to raise them are being raised by their grandparents, older relatives, or others.
I'm sorry, I stepped out. I had to step out for a little while to do some of my own caregiving of a young child, but
understood.
But somebody else had also raised this point, and I know it's come up before, the sort of language about older.
Yes.
So maybe it's just also a note for us as we, go through and make sure everything is sort of clean and consistent, that we remove that language about, older relatives.
Yeah, but perhaps just by their being raised by their grandparents and other relatives.
Yeah, and maybe even if we could make it more inclusive, or make clear that that this definition of family is expansive and is not necessarily just, biological ties. It seemed like that was sort of the direction we were going in. Just some way to communicate. I mean, we don't want to exclude people.
Right.
So I pasted in the chat box a proposed definition. When we say just others, that could potentially include unrelated foster parents, who is, I think, not who we're including. So I dropped in the definition that we use that's somewhat parallel to what was in the definition guide, but it's a little more inclusive.
This is Gail.
I want to say we don't want to include unrelated foster parents, so I wouldn't put them in the definition. I'd suggested some language in the chat box. Sorry, go ahead.
Sorry, this is Gail. I'm just looking at the statement of which children whose parents were unable to raise them. I think there's a much better way of stating that without being quite wordy and not quite talking about the parents who are not able to raise them. I just think I don't like that sentence.
Gail, what would you suggest? And then I'm sorry, Jaya, go ahead.
I'm struggling with it. I just don't know.
Just who are not being raised by their birth parents.
So I can just read what I put in the. Oh.
Yeah. Go ahead. I'm sorry.
That's okay. I could read what I put in the chat box. So this is the definition that we've used, and feel free to give feedback. Families in which children reside with and are being raised by grandparents, other extended family members, and adults with whom they have a close family-like relationship, such as godparents or close family friends. Relatives isn't in there. We used extended family members, but you know, we could use whatever. And that's in the chat box if you want to just cut and paste it somewhere. That might be the easiest way to do it.
Yeah. Jay, I'm sorry, I don't see what you put in the chat box. I don't know if it's not showing up for me.
I think I accidentally sent it just to Cheryl. Let me make it more.
Okay. Thank you, Jaya.
Sorry about that. I will fix that.
Okay.
Since Chantal is typing away, she may not be able to look into the chat boxes. So
yeah,
maybe most helpful to state it.
Oh, it looks like she got it.
Okay, great.
This is Sharon. Were we going to be taking out the part about parents are not able to raise them? I think that's what Gail was getting at. We are highly sensitive to trying to maybe heal a family in the future. And so I know we try very hard not to have a negative reflection on the parents.
And also noting that some of the parents are still somewhat co-parenting. Mm-hmm. I just really feel really strongly about saying parents not able to raise them. Because also some of our grandparents are temporary until the parent is able to do what they need to do so that they can parent.
So for better capturing, if we could have the suggestions so that we can formulate our what's on the screen, I think that would work better. The solutions, if we focus on the solutions, because we're I'm looking at our clock and we want to get through this segment.
So what do we? So it looks like in the rewritten version of the first guiding principle, it looks like what's down below the number one. What do folks feel about? How do they feel about that? Does that alleviate concerns about referencing parents not able to raise children?
I like that much better. And I'm just not sure about the word intertwining terms. I'm not sure we even need to mention that those terms are interchangeable, but also that they are inclusive and holistic. I'm not really sure what that means. I don't, my opinion.
Terms that describe, or terms that describe families.
I think, yes, I think we recognize or define grandfamilies and kinship families. This term describes, these terms describe families in which children, I'm not so sure, again, we need intertwining, inclusive, and holistic at this point with that.
What about we recognize, define grandfamilies and kinship families as families in which?
Okay. Read what we have so far. We recognize and define grandfamilies and kinship families as families in which children reside with and are being raised by grandparents or other extended family members and adults with whom they have a close family-like relationship, such as godparents and close family friends. Okay.
Last opinion from Charlotte. I would just put a period at the end of relationship. The such as godparents and close family friends is still a category in my mind under the others. Extended family members and adults with whom they have a close family-like relationship. I don't know that we need that additional text there. Thank you.
Okay, that certainly does shorten it. Okay. All right, we recognize and define grandfamilies and kinship families. We're going to capitalize the K as families in which children reside with and are being raised by grandparents or other extended family members and adults with whom they have a close family-like relationship. Okay, all right. In interest of time, let's move on to number 2. Which originally read as promote greater adoption of person and family-centered support that place, and we're going to insert our 2 terms, grandfamilies and kinship families, at, screen jumped a little bit, the center of every support system, while also acknowledging the challenge of possible conflicting goals. So based on what we have, we're going to replace with our 2 terms what's in the red, and let's also take out and their families and see how that reads and get your feedback on that.
What is meant by the conflicting goals? What kind of conflicts were in mind in stating that?
I'll refer to the council on that.
Well, this is Greg, and I think in coming up with these very draft suggestions, you know, it was recognizing the fact that the different players or the different parties in a particular family unit may have, you know, a grandparent or a relative caregiver may have one goal, the child may have own needs and preferences, the birth parents may have another set of goals, and these are all things that may need to be considered and balanced, especially when we're thinking about person and family centeredness.
Thank you.
Any comments for number 2 before we move on to number 3? So promote greater adoption of person and family-centered support that places grandfamilies and kinship families at the center of every support system, while also acknowledging the challenge of possible conflicting goals. Okay. All right, let's move on to number 3. Efforts to support grandfamilies and kinship families should further assist their autonomy, choice, and ability to remain engaged and contribute meaningfully in their communities. Any comments?
This is bad. Should further their autonomy, choice. I'm not sure what choice means in this statement. An ability to remain engaged.
What does the council want that to mean? Is that options? Is that another term?
Efforts to support.
I like what Tony chatted in when she said that empower the kinship family to be able to advocate for themselves and meet the needs of the child and family members with available resources. she put that in the chat box. Rather than further their autonomy or choice, it would be empowering them. Anyway, I like that, Tony.
I like that as okay. So where it says should further their autonomy. Wait a minute. Let's see. Go down to empower. Empower the kinship family to be able to advocate for themselves and meet the needs of the child and family. So we can go in and cut and paste from that if possible.
Oh, yeah. This is Lori. I think that was, yeah, Tony. We got it, right? Discussion around the strengths of the kinship family, recognize how they are capable of providing care to the child, and possibly the goal is to empower the kinship family to be able to advocate for themselves and meet the needs of the child and family members with available,
resources. Okay.
Available resources. Thank you.
This is Gail. I'm looking at empower the kinship family. Would it be possible or would it be appropriate to say, if you're going to use kinship family in place of kinship families and grand families, to say kinship families to be able?
Plural.
Well, we want to incorporate our new terms. So we're going to use grandparent and kinship families.
Okay.
And we'll make families plural for kinship as well.
This is Ben again. Do we need to put in to be able, or is it sufficient to say to advocate for themselves?
Okay, empower kinship families and grand families to advocate. That'll shorten a little bit.
Yep.
Okay. So we're looking at empower the kinship families and grand families to advocate for themselves and meet the needs of the child and family members with available resources.
I'm sorry, I have a question. This is Lori. Is this being added to the number 3, or is this a whole new one? Okay, whole new one. Got it. Right?
Can we make it, get some opinions out there? Can we make it a part of number 3?
Or is it number 3?
Right. Thoughts?
This is bad. I see it as number 3.
As number 3, okay.
This is Gail. The thing is, though, I really like the part about being able to meaningfully be engaged in their community. I think that is a really important thing. Our families need to engage in their families so they're not isolated.
So we actually, this is Greg, so to the new part down there, we could, at the very end, with available resources to remain engaged and contribute meaningfully, meet the needs of child and family members to meet the, no, if we just.
We're adding on, Chantal.
Yeah, so delete the, right, so resources, to remain engaged. Right, exactly. Let's see what that looks like. Yep. Kinship families and grand families to advocate for themselves and meet the needs of the child and family members with available resources, to remain engaged and contribute meaningfully in their communities.
Doesn't that assume, though, that they are engaged? And do we know that? Maybe it is about going back to say efforts to support further there. I don't know if I like the choices of words, autonomy and choice, to remain engaged, but
This is Larry. What
To
about just,
become engaged and
right?
to be engaged and contribute meaningfully.
Yeah, to be engaged.
Yeah.
Yeah.
That's more encompassing.
Mm-hmm.
Take off the D off of engaged. Great.
Yep. To engage.
To engage.
Yeah. So get rid of B. Yep.
This is Sharon. Is the very first part going to stay in there? I guess I'm kind of, the word choice is bouncing out at me because more often than not, caregivers really don't have a lot of choice when it comes to how they're involved or what's available.
Well, no, the way I'm hearing it, it sounds like that what was our initial draft next to the number 3 is sort of being crossed out and we've rewritten it.
Yes. Yes. So we now, are we saying that we're starting with empower the kinship families, or are going to leave parts of efforts to support should further their autonomy? I'm hearing some language around autonomy, choice, and ability. So if we take that first piece out and then we just start with empower the kinship families.
Or we could say
efforts to support will empower.
To respond to what Sharon was saying about choice, when we say empower, that is the same thing as giving them choice. So I agree, take out the first paragraph and start with that effect. Efforts will empower. We're giving them a choice by empowering them.
Okay. So efforts will empower the kinship families and grandfamilies to advocate for themselves and meet the needs of the child and family members with available resources to engage and contribute meaningfully in their communities. What's missing at this point before we go to number 4?
I'm wondering if it's 3 things. If it's efforts will empower kinship families and grandfamilies to advocate for themselves, comma, meet the needs of child and family members with available resources, comma, and engage and contribute meaningfully in their communities.
Mm-hmm.
Okay, so we're really focusing on the actions.
The other thing is I don't know if we need to say with available resources, because it'd be wonderful if we could get them some more resources. I don't know. Maybe we could just take out with available resources.
And are we covering that under another principle? Yeah.
So what if we were to say something about having access to available resources?
So meet the needs of the child and family members through better access to available resources, or through improved access, because that's part of the intent of the act, is to make it easier for grandparents and relatives to find what's out there and to access it.
Agreed, with access to available resources so they may engage and contribute meaningfully.
Yes, with improved access, Yep.
To resources so they may engage.
Right. Yep.
Okay.
Okay. Efforts will empower the kinship families and grandfamilies to advocate for themselves, meet the needs of the child and family members with improved access to resources so they may engage and contribute meaningfully to their communities. We're good?
I'm not sure we need the comma after family members.
Mm-hmm. Right.
Okay.
And then we could put and meet the needs of the child and family members. So go up to the second line and after themselves, get rid of the comma and add an and. Yep.
Okay. one last time. Efforts will empower the kinship families and grand families to advocate for themselves to meet the needs of the child and family members with improved access to resources so they may engage and contribute meaningfully in their communities. Okay.
Other than the fact that we have "and" in that sentence twice. Themselves and meet the needs of the children and family members.
That again. And I wonder if it would be efforts. Oh, wait a minute. Efforts that, geez, I had it in my head. Efforts that will empower, efforts will be made to empower. I know it makes it longer, but it seems like it's more realistic to me.
Or aim to empower.
Yeah, that's good as well.
Place that with aim to empower.
And you can get rid of the word "the" before kinship to shorten it a bit.
Okay. Efforts will aim to empower kinship families and grand families to advocate for themselves, meet the needs of the child and family members with improved access to resources so they may engage and contribute meaningfully in their communities. How are we feeling?
We took "and" out and we just put it back in again.
Yeah, Chantal, take the "and" out. I think that's a comma there.
Yeah, comma. Huh?
I think you need the "and" there.
Yeah, you do need the "and."
Yeah,
Sorry.
I don't think it makes sense.
Yeah.
We use it twice. It's just
I'm
it's necessary.
All right.
I'm just wondering, do we need to make another sentence because
I agree. I feel we need another sentence.
Because we've got "and" in there like 3 times in one sentence.
I'm thinking efforts will aim to empower kinship families and grand families to advocate for themselves and meet the needs of the child and family members, period. Through improved access to resources, they may engage and contribute meaningfully in their communities.
Mm-hmm.
Or with improved access, either way, through or with. With improved access to resources, they may engage and contribute meaningfully in their communities. Yeah.
Comment from the chat box. Instead of "and meet," how about "to meet"? Advocate for themselves to meet the needs of the child and family members.
Okay. Feeling good?
Yep.
Okay, let's move on to our next one, number 4. Okay. Okay. Recommendation should recognize and support grand families and kinship families. Let's see, have some things in here. In a fair and impartial manner that also accounts for financial impact while respecting and appreciating the complexity, diversity, and dignity of these families. So we've added our new terms.
I think we need to add "culture" in there.
I would also take the word "also," where it says that also accounts, that accounts.
Okay. And then we wanted to also add "culture," appreciating the, and put that in front, culture, complexity, diversity, and dignity of these families.
I think should it be "that accounts" instead of "also accounts"?
Yeah, that also accounts. Yep. Or that, yeah, that
Well,
accounts.
I think the original suggestion was "that accounts for."
Mm-hmm.
I think I just took out the wrong word.
All right. Recommendation should recognize and support
Grandparents and kinship families.
So
yes.
This is just a question for the group. When we talk about the impact of caregiving overall, we typically talk about the physical, emotional, and financial impacts. sort of three areas. Would we be more inclusive here if not just only mentioning financial, but it's also the physical impacts, the emotional impacts, as well as the financial?
Yes.
Yes.
I agree.
I agree.
Okay. So it would be that accounts for the physical, emotional, and financial. Yeah. Emotional and financial impacts.
How are we feeling about principle number 4?
And how about accounting for that in a fair and impartial manner, accounting for.
Take out that.
Yes, in a manner accounting for physical.
It feels like it ought to just stop with impacts, period. But I'm not, and I agree the other, while respecting those issues should be included, but I don't think it flows very well in one long drawn out sentence.
Hey, Greg, I'm wondering whether instead of accounting, you want to say like strengthening the physical or emotional, financial like needs of families, or I'm not sure
Well,
what you mean by accounting.
I mean,
considering.
So I don't know. I mean, the recommendations that might be made in the report could, I think they're going to be recommendations. I don't know that they're recommendations toward more concrete actions, many of which we may not have control over. So I mean, we could consider that.
I think the word considering would be great.
Instead of accounting?
Or considering, yeah.
In a fair and impartial manner, considering the physical, emotional, and financial
impacts. Yep.
Was that Liliana?
Yes.
Yes.
Great, thank you.
I mean, I think we could leave it, after impacts. Because don't we have in one of the previous principles, was it number 1, where we already know that we're going to be respecting the diversity of.
Yes, diversity was included in number 1.
Yeah, so diversity is covered in number 1. So I think we can simplify this principle by just, what happened? Yeah.
Funky paging.
Yeah, okay, so we're reading number 4 as recommendations should recognize and support grandparents and kinship families in a fair and impartial manner, considering the physical, emotional, and financial impacts. That other segment that we had previously, that's covered in principle number 1. Okay. On to number 5. And looking at our time, ensuring that the needs of grandparents and kinship families are integral to the National Family Caregiving Strategy, which is being developed by the Family Caregiving Advisory Council. Comments, feedback?
Integrated with.
Okay.
Yep.
Rather than integral.
Yep.
So integrated
or
with.
Are addressed in.
I like that, Greg.
Are addressed in the National Family Caregiving Strategy.
Okay.
And this is something that I felt we needed to make sure that the two efforts are connected, since they are legislatively separate efforts, and yet they are very well connected in spirit and in theory. And I think this is a nice way to speak to make sure that what we're doing is addressed by the Family Caregiving Council.
I'm looking back at some of my notes. I'm sorry, this is Gail. I'm looking back at some of the notes I made before the council, and one of the things I was thinking about was making sure that we're hearing the family voices. We say all the time, nothing about us without us. I really would like to make sure that we are making sure that we're listening to the family voice moving forward.
So are you suggesting that we include the reference to the voices in number 5?
And you know, I don't know.
Mm-hmm.
I don't know where to put it. It's just one of the things that I just felt that needed to be addressed. And I don't know that it fits in 5.
Yeah. Now we have the other guiding principle that deals around person and family centeredness. That, let's see. No, never. I think it's number 2. No, number 2.
Down one. Down
one. Not that we want to go back and begin wordsmithing this, but would hearing the voices be understood within person and family centered principles? Because that's where through person centeredness is where you ensure that the voice of the consumer is heard.
And you're right, that would be fine.
You think? Okay.
So, I'm sorry, were we going to add a word to number 2, principles or something? Or leave it as is, Gail? In terms of hearing the voices, including being sure to include the voices of.
Greg does make a good point that it does include that. It doesn't come out and say the exact words, but it does include that voice.
So that works for you?
Yeah, I'm fine with that. I wonder if there's any other comments from our participants on that topic.
I am wondering as well. Thank you.
Any other comments?
This is Carmen.
Line?
Hi, can you guys hear me? This is Carmen Sanchez.
Yes.
Okay, so that's a very passively worded sentence. I'm just wondering whether or not having it something make it more active. You sort of get lost in it.
Which one? Number 5?
Number 5, yeah. So I'm sort of rewriting it in the chat space just to make it a little bit active, like the rest of the guiding principles.
So we could just drop ensure that and just make a statement. The needs of grand families and kinship caregivers either will be addressed or are addressed.
Yeah, or just start with the National Caregiving Strategy will address the needs of families and kinship families, or something like that, even.
Sure. Yeah.
Because that's all you're trying to say, and
yeah, it's more
lost
or less
in the sentence.
Yeah, it's making a statement.
Right.
Basically.
Yeah, and I don't think you need the whole procedure as to who's doing the developing and all that, because after all, it is the Family Caregiving Council, the actual development of this.
So is that kind of where you were thinking about demonstrating that there is an understanding of what the needs are of the grand families and kinship families? I think Gail left. Okay.
So now the National Family Caregiving Strategy will ensure that the needs of grand families and kinship families are addressed, which is being developed by the Family Caregiving Advisory Council.
Just stop at addressed.
So period after addressed. Okay. And then take out the remaining. Okay. Any other comments?
Well, how about the National Family Caregiving Strategy will address the needs
Or include is what I was thinking.
will include the needs of grand families and kinship families, and then get rid of are addressed.
Okay, so we'll put a period after
Quick and
that.
simple.
Okay.
Yep.
Okay, so we got that down to one line. The National Family Caregiving Strategy will include the needs of grand families and kinship families. Okay. Any other comments?
In number 4, can we add culture right there in the one that says considering physical, emotional, and financial? Can you put cultural in there?
Mm-hmm.
Thank you. Yeah, that was supposed to be, yeah.
Maybe I,
Thank you.
This is Sharon. Gail, would that last number 5 be a place to include the voice? Will include the voice or the needs and the voice of families, grand families and kinship families?
Well, Sharon, that's exactly why I asked. I just feel like it needs to be somewhere in these guiding principles. And no one had a response. Like I felt like it was my own.
So maybe we could say will reflect the needs and voices of grand families and kinship families.
Well, I don't know. I think we need to be included that we are at the table.
Okay.
Yes.
Okay. All right. Okay.
I agree with you, Sharon. I think we need to make it very clear that we are listening to the family voices. We sit on the council.
Mm-hmm.
We need to know that we are listening to those voices when we make these decisions.
We're bringing the reality and the actual on the ground experience to these things.
And whether that belongs in 5 or 2, I think that somewhere it needs to be. It doesn't necessarily have to be in 5 because
I like it in 5. I think it really fits well, and even if it's repeated somewhere else, but I really think in this particular one, you may have and nothing against professionals, you may have a group sitting at a table, but if you don't have an actual caregiver amongst them, you just really have a chance of losing the reality of what we face.
So this is Carmen again. I'm wondering whether or not we want to make it even stronger and say the National Family Caregiving Strategy will amplify the voices of grand families and kinship families.
But I think they need to not just be amplified, but included in the decision making.
Oh, okay.
Okay, so we can put include and amplify.
And I would get rid of needs, just the voices of grand families, because the voices includes needs, strengths, it includes everything.
Amplify and include the voices. Or include and amplify the voices, yes.
Okay. So the National Family Caregiving Strategy will include and amplify the voices of grand families and kinship families. Thumbs up. Any other comments? All right. So that is our 5. We were running a little bit over, so I want to be mindful of time. And thank you for participating with your robust discussions, as well as your input into our glossary of terms, our guiding principles, and also our vision statement. So there'll be further follow-up on that. And I'll turn it back over to Greg.
Thank you, Wilma. And I just want to reiterate Wilma's thanks to every member of the council and for the folks around the country who were tuning in. As many of you can tell, we were looking at your comments that you were leaving in the webinar chat, and we were incorporating many of them real time. And so thank you very much for that. I think it just added to the validity of this process, and we're coming away with a much richer set of guiding principles, as well as a vision statement as well. Did we want to take a poll of the guiding principles just to see that we have everybody on board? Or are we, it seemed like I'm seeing a lot of good, you know, it seemed like folks were pretty much on board. So I think we can go ahead and just say, for wrapping up, we're going to take all of the information that we collected today. We're going to produce a small report about this meeting. It will be made available on the website. It's interesting, as we were watching the webinar, and as the webinar was going on, or this meeting was going on for the past 3 hours, we had upwards of 160 people on the line watching at any given point in time. That's incredible. The level of interest that's out there, and the importance that so many people believe this work has, because it is important. So for the council members, you all know that that you all are working to sort through the more than 300 pieces of input that we received from the request for information that was out over the last winter from December to February. And that is actually going to form the heart of the report that we're writing, but we needed to take these actions today to begin to provide some shape to what you all are going to be doing and to some of the decisions that you are making. And I can tell you that we accomplished what we needed to accomplish in this little more than 3 hours. And so I thank you very, very much. We were going to be posting a recording of this meeting, as well as the PowerPoint slides. All of that will be posted on ACL's website. It's acl.gov/SGRG. That will happen over the course of the next couple of weeks as we clean up the transcripts and we get the videos edited and ready for posting. The council members will continue their work. And now that we have Sarah Markell on board, who will begin assisting us with actually refining the outline for the report and beginning to pull the various components together with the input of the council members. So with that, and recognizing that we are now nearly 15 minutes past the hour, I again want to thank you all so much for your time, for your talent, and for your commitment to this issue, and to better supporting grand families and kinship families. With that, I will go ahead and close the meeting, and we will be in touch. Thank you all very much.